Hello, hello, everyone. This is Dr. Garrett Smith, also known as the nutrition detective around these here YouTube parts. And today we have a very special guest about a very special topic to many of us. We have Dr. Julian Camastra. He's a DMD, he's a dentist, and he's a biological dentist, and he's going to talk to us about a lot of the questions you guys have that I simply can't answer because I'm not a dental expert. Like, regardless of how many times I say that, like, let's say my dad was a dentist, my ex-wife's dad was a dentist, Kelsey's mother was a dentist. That doesn't make me an expertise in dentistry either because, well, first of all, I've had very few dental problems in my life. So I haven't had to deal with the system very much at all. So I'm not, that makes me even less knowledgeable. So anyway, we have Dr. Camastra is in the Love Your Liver program, and he's really been enjoying it and getting benefits from it. And he thought he had a lot to offer our people who have all these dental questions. So, Dr. Camastra, why don't we get into a little bit of an introduction about you? Tell us how you got here, how and a little bit of your history and background.
Yeah, you know what? I just lost you for a few seconds, but
Oh.
I think it's okay. I think it's all good. Yeah, thanks so much for having me. It's a real honor. I've been following your stuff since Beth Martins introduced me to you last June or July, and I'm kind of like I'm a pretty open-minded guy. And I never really like marry myself to whatever belief system I'm currently onto. I'm always, if new information comes in, I kind of have a rule that I have to consider it and at least look into it first before I just say, no, that's crap or whatever. So yeah, I kind of came into your world like reluctantly with some skepticism, and then it didn't take too long to start connecting some dots. And then I'll try. I'm kind of like you. Like I'll try anything on myself, and
Right.
even some of these devices that we talk about in dentistry and stuff. It's like, yeah, if I hear about something, I'm gonna order it. I'm gonna try it, and then we'll go from there. So I basically just said, okay, let me try this vitamin A thing and see how it goes. So I've basically been following the low vitamin A, and then more recently Love Your Liver. I started in July, and yeah, I'm really grateful for all your work and your teachings, and so it's such an honor to be here. So thanks for having me. Um, I guess, yeah, I graduated in 2016. I went to school in Boston for dental school. So I graduated in 2015. I started practicing in 2016. I moved back to Canada. My dad's also a dentist, so I joined him in practice. He practiced since 1982, and he just retired last year. And then my brother is with me as well, so we've got a family practice, and it's kind of a large practice. We work with a group of dentists. So yeah, I joined my dad's practice in 2016 and started working like, I guess you'd call it conventional dentistry, just sort of what we were taught in dental school. And I went to some advanced dental training courses to do more comprehensive dentistry and full mouth reconstructions and all that sort of thing. So I was going along, and then the thing in 2020 happened, and kind of rocked my world a little bit, and my whole worldview. And I reached a point like going down the health rabbit hole where I couldn't ignore dental, right? And I was starting to look at a lot of the things that I was doing with my patients, and I reached this point where I I realized I was like, you know what? I wouldn't really want these treatments if I were on the other side of this and I were the patient. And then it kind of got pretty dark, like because if you're somebody who holds themselves in to a high standard, then there's an integrity issue. And so I didn't even know there was a period of 2021, 2022 where I was like, I don't even know if I can do this anymore. And it led me to find some other dentists in Europe that were thinking differently and speaking differently on these things. I went to a couple of courses, and the big difference was that the the courses I used to go to that were teaching all this big full mouth reconstruction stuff, there was nothing on health. There was no mention of nutrition and all these other things that we're into. When I started going to these biological dentistry courses, the guys teaching it, they themselves were the spitting example of health. Like one of the guys who ended up doing my surgery, he was like 57 years old and he looked amazing. He looked like, he's from Switzerland. He looked like Roger Federer. He was like just the picture of health, and everything he spoke about in the dental side was connected to some health principle. So that resonated with me, and I went down that path. I went to Europe 3 separate times for training over there, and then I just set it as my goal to recreate what they had done there in Canada, where I'm from. And sorry. So yeah, I've been on this journey since late 2022, 2023. I had my own surgery done in Switzerland, and then I've been building my clinic since then, and it's been going really well, and we're doing some really cool things. The one thing that I noticed that we still have deficiency in is on the detox side. And so we do all this work for patients, and we're helping them optimize nutrition and all of these things. And then we remove a bunch of stuff from their mouth that shouldn't be there and is not really compatible with the body. A lot of people get better. I watch patients get better right away sometimes. As soon as you take out the thing that's nagging their system, you just, a lot of symptoms go away in other areas of the body. It's really cool. But there's a lot of patients that they struggle and they're not clearing properly. They're not detoxing properly. All I really learned in my training was give them chlorella and just, like have them take, after the procedure, have them take, handfuls of chlorella essentially through the day. And so I quickly learned, after having some patients that didn't do so well on that, I'm deficient in the knowledge about detox and true detox. And so in order to kind of further my ability to help my patients, that's the area I realized, yeah, I need to level up in this detox. So that, I've looked through some different programs and everything. Yours by far resonated the most with me. And so that's why I'm here. And yeah, I think that covers it all. Is there anything I missed there?
No, I mean, well, I was thinking we might go into some of your results from doing it maybe later.
Yeah.
I mean, we could do it now, but we could also do it afterwards. So, yeah, you have a whole presentation for us that you wanted to go through.
Yeah.
Interesting things that you've connected. So yeah, I think we're ready to head into that, and then after that, we'll hit your history on the Love Your Liver, and then we'll do. We have a couple of questions to go over that were pre-sent, and then we'll go into any live chat or super chats or any of that stuff.
Yeah, sounds good. Perfect.
Yeah, dig in.
And just let me know if the audio is okay, if I can go inside here if it's too loud.
Okay.
All right. So what is biological dentistry? There's this great video. I'm not going to play it, but it's called "It's Not About the Nail," and I like to show this at the beginning if I'm giving a talk to dentists or anything like that. And this video is really funny. It's this wife and husband having a conversation, and she's talking about this crushing pain she feels in her head. And then she turns sideways and she's got a nail sticking out of her forehead. And her husband is like, well, babe, I think if we just get that nail out, you're going to feel a lot better. And she's like, stop it. You always try to fix it. I just want you to listen. And anyway, it's hilarious. And I really love this analogy for biological dentistry, because there's all these symptoms that we see with our patients, and it could be anything from joint pain to skin issues, all these kind of things. And when we look in the mouth, and I'll go to the next slide here, we see things like this. So it's a construction site in the body, and 20th century dentistry essentially has placed all of these foreign objects in the body that the body doesn't like having them there. And so it's like having a bunch of nails in your head. And sometimes if you just take the thing out that is causing the inflammation or the disruption to the system, then the body and the system can just repair on its own. And it's really nicely aligned with kind of natural healing principles. It's just like, get out of the way of the body, and the body knows how to heal itself, right? So that's what I really like about biological dentistry is you're working with the body, and you're just you're removing things that shouldn't be there, and then doing your best to use materials that are neutral to the system and not a trigger. And materials are always evolving and improving, so I'll show you guys what we're using today and what works with our patients. And that's not to say that there won't be future advancements that make these things even better. So that's biological dentistry in a nutshell. It's just taking things out that shouldn't be there and using materials that are more friendly to the body in the simplest possible terms. We kind of went through my journey earlier, but I've got just some pictures here of my mentors along the way. So this is Dr. Ulrich Wulst. He is the guy from Switzerland that I mentioned. So when I went to his course in late 2022, I went and asked him about my tooth. I had a root canal in my front tooth for 27 years. And he said, yeah, I think it's a good idea to have it out. And tell you what, if you come to my course in Switzerland, I'll do it for you. And you can be the live demonstration in front of all the dentists in the course. So he's the leading guy in the world for ceramic implants. And so after I decided that that's what I wanted to do, I wasn't sure at first, but after enough research, I decided that I was comfortable with that treatment. I went, and then it was kind of a life-changing experience, transformational thing, mind-blowing. And I just at that moment decided, yeah, this is what I'm going to do. I'm going to bring this concept back to Canada. So that link you see there, I put together a list of all the links that I'm going to talk about, so you don't need to bother writing things down. There'll be like show notes with all the links, but I made a video about that whole experience on my site there. And then the guy in the middle, his name's Dr. Dominic Nischwitz. I started training one-on-one with him in subsequent years, and he was an amazing mentor and became a great friend. And so I went and trained with him in his clinic in Germany. He's on a mission to change dentistry forever. He wants to change the profession of dentistry from the technician to the physician. And like dentists traditionally we're just like mechanical fixers, and we just repair things in the mouth. And he really is an advocate for no, as dentists we should be overall health experts and be able to guide our patients toward optimal health. So he's training dentists all around the world. He's got a directory of dentists he's trained, so if you're looking to find if there's someone near you, he's got a directory. And then here's me with some of my team in my clinic. This is when I got my tooth surgery done in Switzerland. So part of the concept is before you have the surgery, you get a IV infusion, you get a craniosacral treatment, and you're lying in a PEMF device, and everything is geared to treat the nervous system and put you into a more relaxed parasympathetic state before going into the surgery. And for me, it was really good. I actually was pretty nervous about I didn't have an infection or anything, so I was electively pulling my front tooth out. And so I was a little nervous. I was like, I could be making a mistake here going in. And so, but then when I was greeted by this woman here, her name is Ursula, she's a nurse, and she was like my guardian angel, took me in, started me on the IV, and then I felt so safe and so comfortable that all that anxiety went away. And I was just like, no sedation, nothing like that, just very comfortable, and I felt safe. And then it was that feeling of, yeah, you guys can do whatever you need to do to me. I know I'm in a safe place. So that's really, I took that to heart, and that's the spirit I've brought back to the clinic now. And I tell all my team that, look, like, people are nervous when they come in for this stuff. Our job is to make them feel safe, that this is not a regular dental office. They're in a safe place. And so, yeah, a little bit of overview of all the different areas of dental disease that we're going to talk about. So we've got toxicity. I know that's a favorite for this group, so we'll start there. There's metals in the mouth. There's infected root canals. I like to make the distinction of infected versus not, because there is a difference. And my message is not like, go run and go get all your root canals pulled. It's not what I want people to take away from this. But they can be really prone to getting reinfected. So I'll show some of that. And then cavitations. It's a topic many people haven't heard about, so we're going to really dive into that one. Then we've got degeneration. So kind of on the theme of toxicities and deficiencies, we can see this pattern in the mouth. And when we have things like tooth decay or cavities, or when we have bone loss, gum and bone degeneration, which
Do we lose him? Hold on, Joe. What happened? There he is.
Hello?
You're back. You're back. I don't know what happened there.
How long was that?
Just a second. Just a second. You were talking about let's bring the screen back up. I'll tell you where you were. You were talking about the bone and gums to periodontal disease. You weren't gone for half a second.
Okay, perfect. Okay. Yeah, we'll get into that, and then we're going to do the whole structure conversation. I listened to your conversation with Ken, the recent one, just so I could see where you guys were at with that and just add my 2 cents into that conversation. So yeah, let's go. We'll kind of fly through this stuff because this is nothing like, this is part of Love Your Liver, get the mercuries out, all that stuff, right? So there's all different kinds of metals that can be in the mouth. We've got amalgam is one of them. Amalgam is usually around 50% mercury. It's the most toxic non-radioactive element on the periodic table. Then we can have titanium in the mouth. The titanium implants, they're not pure titanium. They're usually around 95% titanium. They have either nickel or vanadium or aluminum. It's an alloy, and so that's one of the issues with titanium implants, is that they're not pure titanium. And even if they were, they would still have issues. And then gold is a common metal that's been used in dentistry. Stainless steel bars. So people who've had orthodontic treatment braces, they'll have those bars bonded to the back of their front teeth to keep the teeth from moving. Chromium, cobalt, there's all these different metals that can be found in people's mouths.
Do you mind if I just add something real there?
Yeah, of course.
So you probably heard me talk about the high copper fillings, the high copper amalgam. They can use up to 30% copper now. It's a relatively newer thing. But so now you got mercury and copper coming out.
It's a new thing? So it's like a new amalgam thing. Oh, yeah. Wow.
And they were trying to say in the research that I did on it, it said that the copper ones, they said, were stronger, but now they're getting ready to like potentially reevaluate all of it because they're finding that the copper's really coming out. Like they're actually softening. And of course, they didn't really do enough long-term research on it. And now they're saying these copper things are really falling apart, basically.
Yeah. The funny thing is, one of the good trends in dentistry is that even aside from the health stuff, it's gotten away from, like, most dentists aren't placing amalgam fillings anymore because patients think they're ugly. And yeah, like, so that's kind of a nice trend that's been happening. Like most dentists that even are not health focused have moved away from putting in new amalgam. So that's good.
Mm-hmm. And then we'll sometimes see, like, as people go through our stuff and they're doing the hair tests, we'll sometimes see like detoxes of those minerals that you mentioned. We'll see cobalt come out or chromium come out or these things come out. And I'll ask the people, like, do you have anything metallic like implanted in your body, whether it's surgical or dental or orthodontics or whatever? And oftentimes they'll say, no, not right now. And I'll say, did you have braces as a kid, or did you have like a retainer for a long time? And they'll say, yeah. And I'm saying, this is you actually dumping this stuff out of your tissues. So yeah. So anyway, that's all I had.
Like, it's one of the missing links for alternative healthcare practitioners, naturopaths, functional medicine doctors. You're trying to help these patients, and you don't know what might be going on in their mouth. And that X-ray I showed you at the beginning with the construction site, like any healthcare provider can be trained quite easily to identify, like, what's a metal on one of those X-rays. You know, is there root canals? Were the wisdom teeth taken out? Those kind of things. And so it's a really good bit of information that most healthcare practitioners should have as part of their assessment of a patient. Because like, you could be trying to help someone detox from these things, and it's like, oh, but there's literally a source of it still in the mouth, right?
Right.
Okay, so the issues with metals, we've got toxicity in general. There's also corrosion that happens with metals. And then the other thing is that this was never a problem 30 years ago was the EMF kind of antenna side of it. So it may not have been such a big deal to have some of these metals in your mouth in the 90s or in the 80s because we weren't constantly surrounded by EMFs. And now if you get, like a titanium implant, for example, this is why with my tooth, even when I wasn't biological, I was aware of EMFs and I didn't want a titanium implant in my front tooth there because I was like, well, that's an antenna. And, I'm turning off my Wi-Fi at night. I'm doing all these things to try. And then, I'm going to go amplify the signal if I do something like that. Right. So, are you aware of this, Dr. Smith, the galvanic corrosion effect that can happen when you have two different metals in the mouth connected with solution like saliva?
No.
So it's like a battery. It creates a battery and
Oof.
you get a flow of electrons from one metal to the other metal, and then it accelerates this corrosion process. So it's called galvanic corrosion. You can look it up and it'll come up. This is a fact to any physicist or engineer. If you ask them, they'll be like, yeah, no kidding. Of course that's going to happen. But for some reason in dental school, it's never brought up that, hey, by the way, when you put two different metals in an area connected in solution, you're going to create an electric current through the two of them. So yeah, it's wild.
Well, I wanted to mention too, like the whole alternative community right now is all freaking out about aluminum and everything, about them turning us into antennas, like you were mentioning, EMF antennas by aluminum. But then they completely ignore that, like almost all the wires in your house and everything that we were running is copper. And they're actually,
exactly.
I posted that article about, they were saying excess 6G energy could be collected by a copper wire, a copper coil on your body to power your wearable devices. And I was like, this same thing's going to happen in your body. And now they're putting copper, up to 30% copper amalgams in your mouth, and they're just turning. But then there's the whole alternative push, right? They've already made mercury a bad guy. Okay, like that makes sense. But there's this whole alternative push to just get more and more copper into people because they still think copper is good for you and harmless. I'm like, you're turning yourself. They just told you with that copper coil, they're turning you into an antenna.
I wasn't introduced into the copper toxicity thing until you.
Yeah.
And that's really what made it click for me, was the copper conductive wires in house and stuff like that. And then it's like, yeah, that makes complete sense. And it's another thing where the environment has changed in the last 30 years. And so we're more susceptible to those problems now than maybe those problems weren't there 30 years ago. Right.
Yes. That's all I had. Keep going.
Yeah. So you guys know about the SMART protocol and like the IAOMT stuff for safe amalgam removal. So there's a site and there's a directory to find someone to help you with that.
Are you one of those?
And
are you on their site?
I'm a member of the IAOMT. I did the training and everything. I kind of made a choice with my practice that I want to be more focused on surgery and like doing the stuff I had when I went over. I wasn't that crazy about being like just an amalgam removal guy and just having people come, because it's not very fun, So
no. If you do something different, then and you're good at it, then yeah, absolutely, do your thing. Yeah.
Our practice does it. So I work with a couple other dentists that do the SMART protocol and all of that. So yeah, it's something we do for our patients. It's just my focus is more on the surgical side.
Cool.
Okay, next topic is the root canal topic. So what we have here is a patient presented with a obvious, I know the whole, like, I'm aware of the whole, there's the germ theory, terrain theory, all of that. I named my practice Terrain Dental Wellness, so I'm not a germ theory guy. I still use the term infection. It's just, it's handy. These teeth basically become shells, just like caves for microbes and everything to live, and they just start decomposing, just like anything dead in nature. A root canal tooth is a dead tooth, and at first, that tooth still has its structural integrity, but it doesn't have any blood supply or immune support or nervous tissue in it anymore. That over time, it starts to degrade. And just like a tree that might fall in the woods, it starts to become very brittle and weak and just compromised structurally. And so that's what happens to these teeth, is that they just become these caves for bacteria and other microbes. And then those microbes start to deteriorate the tooth. And then you get presentations like this, where now all kinds of stuff is being released from inside that tooth, and it causes a area where the bone starts to degenerate around the tooth. And this is what we call an infection. So patient presents with this problem, and this patient actually has prostate cancer. And so I'm looking at him from a full body approach, and I know this tooth needs to come out, but I'm looking at this one and I'm like, I really think we got to look to take this one out too, because you're having all these health issues. And, we know that there's a lot. This is the guy I showed at the beginning of the thing with the construction site in the mouth.
Oof.
Yeah. And so he wasn't on board with doing everything, but I was like, at least let me take this one out for you, because I'm quite sure that that one's not healthy. And so when I got the crowns off, you can see this is the one that has the infection. The one in front that looks okay on an x-ray. So in conventional dentistry, like, we learned that if a tooth looks like this, it's good. Like, that tooth looks fine, nothing needs to be done. But it's totally black and diseased. And
Like, it's
this
worse.
is yeah.
Yeah.
Like, so these are the two teeth. Once they're out, this is the one that looked okay on the x-ray. It's totally necrotic. And so it's just, I like these examples. I have one more I'll show. And so
Actually,
these are some of the, yeah, go ahead.
I tell people, like, the people will even go to like biological or like, the more alternative dentists that I know around in town, and they'll do the fancy imaging. You guys have different imaging.
Yep, I'm going to show
better
some
in-
of that. Yeah.
But sometimes they'll just be like, there's not a problem here. And I'm just hearing what you're saying, and I'm going, there may still be a problem there.
Yeah.
Like, just because they can't visualize it, there may still be a huge problem there. And I just figured that out from what people told me. They said, I went to the dentist and a bunch of dentists said that it was fine. Like, it's
Right.
totally fine. There's no cavitations. There's no nothing, but I wanted it out. And then
Yeah.
the dentist went in there and they pulled it out and they were like, this was horrible underneath
Yeah.
it.
Right.
So yeah, it's just, I don't know what imaging they got to do to see it, but when you're having your gut feeling or you're training and you're just going, this just doesn't seem good, so it should probably come out. Like, I trust that more than I trust the imaging. So go ahead.
Yeah. And also, like, it's, if I've got a person in front of me who's like, I have no health issues, I feel great, I'm like, cool. Like, then you decide what you want to do. And if you want to leave it, then that's totally fine. Like, it's your body and you decide, right? So, but when someone's coming to you and they're struggling with their health and they want to improve their health, and you're looking at these things and you're like, yeah, probably your system is not compensating very well anymore. And so that can help. There is talk of, like, we use cone beam CT scans. So I'll show some of that later. Then there's MRIs. They will actually show to a greater degree. We don't have MRIs in dentistry being used regularly, but that might be something in the future where you can actually get a better look. There's some of those energetic devices too, like bioresonance and bioenergetics that can, like, you have the person like touch their tooth and you hold the thing. And I mean, I've seen some of that, and it's actually pretty crazy how it can read like energy that is just not, the energy in the area is not vital. It's not, have you seen some of that stuff before?
Not too much, but I believe it. I mean, it
Yeah.
makes sense.
Yeah. So there's things like that. And even like muscle testing, people get into muscle testing and you can sometimes do these things. So, all right, we'll pull the slides back up. So yeah, these are some of the toxins that can be coming off of teeth like that. So we've got endotoxins, lipopolysaccharides, TNF alpha, interleukins, and cytokines. These are all things that can be measured to come off of these teeth like this. We've got another patient here, similar kind of situation. She's got 1, 2, 3, 4, 5, 6, 7 teeth with root canals, so 7 dead teeth. This is the one you can really tell. See that infection there, where the bone's being eaten away there. The other one's not so much, but this patient had all kinds of joint pain. And actually, I started treating her before I got into all this stuff. So then I got into what I'm doing. I offered it to her. She was interested because she trusted me. And then one day later in the future, she came and I asked her, "Hey, like, have you noticed any health improvements?" And she's like, "Now that you ask, I used to have all this joint pain and I couldn't even like put on sandals or walk up the stairs." And she's like, "I don't have that anymore. I totally forgot about it." And so we took out all these problematic teeth. Same situation. This was the one with the infection. The one beside it looks totally fine on the X-ray, and that's the one that looked fine. And it's like a gangrenous thing, right?
Yeah.
So here's how we're replacing teeth mostly. I'm going to show other options too, but here's what I did for my own mouth, and this is what I'm doing for most of my patients now. So we took out all those root canal teeth. In this case, this is the day of surgery, and then this is once everything is healed. And what I love about these ceramic implants is that you can really see the tissue doesn't show any inflammation around them. The tissue is perfectly healthy. The material is called zirconia, which is zirconium dioxide. It gets confused because zirconium is a metal on the periodic table. When it combines with oxygen, it's no longer a metal and it becomes a ceramic. So it's an analogy is sodium is a metal, and when you mix sodium with chloride, it's now salt. So sodium chloride is not a metal anymore. It doesn't conduct electricity. It doesn't act as an antenna, all those things, right? So you'll hear people say, "Oh, but zirconia is still a metal," and that's the kind of the science on that. So it doesn't behave like a metal, and so that's why I was comfortable with putting it in my own mouth. This is how we restore those implants. So like when you're doing somebody's back teeth, you don't put a tooth on it right away because you don't want them to chew on it while the bone is healing. You want to wait. It's usually around 4 months. Then you can attach a tooth to it and then they can start using it. When we do front teeth in the smile zone, you can put a tooth on it right away. You just instruct the patient, don't bite into sandwiches. Don't be like biting into apples. You got to cut your food up small and chew it in the back because the temporary tooth we've given you is just for show. But when we're ready to put the teeth on, we put these posts, cement them in. We shape the implant, custom shape it, and then we shape the gums, and then we make teeth. We use a lot of like in-house CAD/CAM milling technology. So we've got a mill, and you got a block of ceramic, and it mills out the custom teeth you've designed on the computer. So patients can, while they wait, we have their teeth being made for them rather than take an impression, send them home in a temporary, and then come back 2 weeks later. We've kind of eliminated that. In most cases, if you need customization and things like that, where it's a difficult shade to match and stuff, then we'll use a dental lab to do like that artistic work. This is a nice histological slide that shows what the tissue types actually look like adjacent to the ceramic. And so what's really nice is you can see there's no inflammatory cells, and the tissue, the bone and the gum tissue form a junction and an adhesion with the ceramic. And that's really nice because it forms a seal from the rest of the mouth. And so it seals it off so that just stuff from the mouth doesn't get inside the body. And so I'll show other examples. That's a conversation when we talk about wisdom teeth, of why that ends up causing problems when you don't have good seals in your mouth around your teeth or around implants or around wisdom teeth. This is my tooth. That's my front tooth. There's the ceramic implant. There's the final crown that was put on after. So this one needed some of that customization that we were talking about. Here's another one. I love this picture. It was a patient of mine, and it just shows how beautiful the gum tissue looks around that ceramic material, and it's tightly sealed there, so there's no pocket. If I blow air with my instrument, my air water tip, the tissue doesn't open up away from the implant. It's sealed on there. And so when we do these implants and we're finished and we put the teeth on for the patient, we always tell them, be very careful. Like if you want to use floss or something, just floss in the area above the gum. Don't pull it below, because the floss can cut the gum tissue and then create an opening. And that's the same with natural teeth too. Like, I'm not against flossing, but you can do damage with floss. People overdo it. They pull it down too tight and you're cutting the gums, and then just the seal is now compromised. And it's like leaky gut. We call it leaky gum. And so your seals aren't good, and it's your body wants to keep what's out and what's in, and we want to minimize the number of openings from our inside system to our outside system. You may have heard of bridges. So it's one of the options for replacing teeth. The issue with bridges is you've got two healthy teeth on either side. You've got to cut them. You've got to shave away a lot of healthy enamel and tooth structure in order to make room for the material of the bridge to go in there. And so by trying to like solve one problem and replace one missing tooth, you're compromising two more teeth. And it can be fine and inconsequential. If a patient has already had a lot of work done on the adjacent teeth, like fillings and like a crown or something like that, then you can justify it a little bit better and say, yeah, this tooth's already had its enamel removed. If I just, clean it up and do a new one. I still do bridges for some patients, right? Just in an ideal world, in my opinion, the ceramic implant is the better choice. So with the conventional bridges, you've got the adjacent teeth, we call them the abutments, and then the bridge sits over top. And you've got to shave the tooth down, because if you don't, you'll have these really bulky teeth that won't fit in your bite and they won't be comfortable. So that's the compromise with bridges. Then you've got Maryland bridges, which are very conservative. You don't shave away the tooth structure. You just have these little wings on the side of the false tooth, and then you glue them onto the adjacent teeth. They can work. They are notorious for falling off and being a problem, especially if you're biting into it. Like, you can imagine the forces that are going to be put on that bond. If you bite into something hard, it can just dislodge it and come right off. And at least in my practice, I really love when I can see patients once and then they're better and they go off and live a healthy life and I don't need to see them again. My practice model is all reliant on new patients, and it's like tell your friends sort of thing. I don't like when patients walk back into the office and say, this thing you put on fell off and it's a problem. And so I don't like doing these Maryland bridges. Some dentists are good at them, and it is an option, but from what I've seen, they're just very prone to falling off. Then you've got things like this. This is called a valplast partial denture. So partial dentures, conventionally, they have a lot of metal, right? That's what gives them the structural support. And kind of when in the health, biological area where we are, we're trying to reduce that. So this is a good option. It's not as strong, but I've had patients be very happy with this. So this is kind of your low cost option to replacing missing teeth. And they're flexible, so people find them rather comfortable, and the material is not so irritating to the tissue, and it's a decent material as far as the things that you could have in your mouth. Any questions on those before we go into the next topic?
People can chew with that valplast one?
Yeah, it's not as good. It depends, right? So like the example here, it shows, okay, it's going to attach. So the missing teeth are the ones that you see,
Right.
And then the ones where there's a hole is where the patient still has their own teeth. So these little hooks hook onto the teeth that are still there. So like there's one in the back, one in the front. So it would be pretty stable because it's got a lot to hold on to. If you lose too many teeth and there's not enough just to hold
Right.
on to, it can be unstable, right? So it's one of those it depends sort of situations. And it's also about the person's ability to adapt to something new. Whenever you have something change and new in your mouth, it's weird at first. You don't know how to chew properly and where does your tongue go and all of
Mhm.
that. And so most people I find are pretty adaptive. Some aren't, and some can't get used to certain things, right?
Yes.
Okay, so now we're going to switch gears here. This is the topic of wisdom teeth, and particularly after wisdom teeth have been done and taken out and the patient didn't heal properly. So we call this cavitations. Other words for it are that are floating around out there, NICO or FDOJ. So FDOJ is the more common one. It's fatty degenerative osteonecrosis of the jawbone. And what happens is when you take out a tooth, so this is a tooth here, it's embedded in the bone naturally. When you take out a tooth, you're left with this socket, we call it. And so the roots of the tooth were sitting inside of the bone, and then it's gone. What happens normally if you don't put anything back in there is the body will fill it up with blood, and then ideally over time through just bone generation, your body grows new bone into the space. That's what's supposed to happen. Unfortunately, it doesn't happen these days. I think it's connected just to the toxicities and deficiencies and just modern living. We just don't have this regeneration capacity as well as we should. I didn't freeze. Am I still, you can still
No,
hear
you're
me?
still going.
Okay, good. I thought you froze. I saw your head. I
No,
was
I
like,
was looking at my
okay,
other screen.
no. I was like, did he freeze?
Nope.
Okay, so in this x-ray here, you can see all of these areas like I showed you before with where those infections were around the root canals. Areas where bone never regenerated. So it's just like an area of very low density tissue. Whenever you see a dark area on an x-ray, just like here is black, it's in the mouth, there's nothing there, so it looks black on an x-ray. Same in the sinuses, there's nothing there, it looks black. When you're looking at bone, it means that it's very, very low density if you see this type of appearance. So bone never grew back into that area. And these can be triggers for the immune system and just a constant source of chronic inflammation. So we've got, let me show you this video first, and then I've got a slide about the toxicities. But yeah, so we're in the wisdom tooth area here on the upper, and it's where the wisdom tooth was taken out, and we're cleaning it out, and all you can see is just fat droplets and globules coming out of there. It's very fatty blood and fatty bone, fatty tissue. It's like a diseased bone.
We notice a color theme in there, right?
Yes, yeah, exactly.
The yellow, folks.
Okay, so you just clean it out until you don't have any more of that fat, and then you see clean, healthy, vibrant looking blood. Once it comes back into the space, then you know you've done a good job cleaning out those areas. This is a lower. So the lower, what happens is the bone actually heals over on top, like the cap, the roof of it, but inside is where it doesn't heal. And so we make a window in the bone in the wisdom tooth area, and then we remove that plate, that roof, I guess, and then go in and we find all this fatty tissue in there. So when you're seeing that oily droplets, that's fat in the blood. It's like a I don't want to ruin people's dinner, but I like to say it's like a meat sauce, like a,
It's like marinara with too much oil in it or
yeah,
something.
with the oil from the fat. Yeah.
Gosh, that'd be weird. A toxic dying area with lots of yellow fat in it. That would be such a weird coincidence with what we do, right?
Yeah, exactly. The thing is, the bones are generally like, especially the jaw bones. There's no marrow space in the jaw bones.
Mm.
So, like a bigger bone, like a femur or something, it's got a bone marrow chamber. So the jaw bones don't. They just have this cancellous bone in the middle. You have cortical bone on the outside, cancellous bone on the inside. It's like a spongy appearance bone.
Oof.
It's not very well perfused by blood. So it's hard for the body to get in there and change things out. It's just not, doesn't have good blood supply. So that, these show what we find in there when we get in there and clean them out. And yeah, I think that's pretty good on that. So studies have been done on this tissue, and you can see how yellow it is. Thanks for pointing that out. The things that we find in the blood, actually, these are blood tests of the patient. It's not a tissue sample. It's just testing for these inflammatory markers in patients' blood who have these lesions in their mouth versus ones who don't. And so the blue are the patients who don't. So you have these factors, FGF2, IL-1RA, and then the big one, the most famous one in the research, is called RANTES, or the other name for it is CCL5. So you can look at these measures in the blood. Unfortunately, it's not easy to get these tests done. So this was more in a research setting. It's not something that we do to like test, but it could be. There could be advancements in that area where you can test for these things in patients' blood. And so, yeah, it's like the analogy is like the alarm. These inflammatory factors are like the body's alarm system that there's something going on. And when those are raised chronically, they cause issues. When they're elevated just acutely, it encourages all the repair systems of the body to come in and fix the problem. Like if you were to get a cut on your arm or something like that, all these things would be naturally upregulated, but then the repair would happen and then they would go down. But with these areas in the jawbone, it never, the body can't repair them, I think because of that blood supply, limited blood supply issue. And then these markers are always elevated in the person's system. And it's one of the reasons why we see people's health improve dramatically once we remediate this issue. So this patient here, this is one of those lids that I took off, and so that's the bone on the outside, and this is the inside, and you can see the fat deposit right in the bone. And so this patient, she found me. She was in Connecticut. She came up to see me, and she had MS. So she was having all the symptoms of MS. She was getting numbness in her hands and having these other symptoms. And she had the brain scan and all those things where they said, yep, you've got the spots on your brain and you have MS and you're going to be with it for the rest of your life, and maybe on drugs and whatever. And fortunately, she didn't accept that answer. And so she came on her own research onto this area of the cavitations. And then we did it. And while she was in the chair, as I was cleaning them out, she started feeling the feeling in her hands coming back. And it came back totally. I saw her the next day. Her hands were normal. And she was very emotional. It was like, because she went through a lot of stress with this whole thing. And then I kept following up with her the months after, and her symptoms were better. They were gone. And I don't know if she doesn't have MS or what. I don't know, but her symptoms went away. So this, in her case, this was a major blockage for her system, affecting her system. And as soon as we removed it, it was like taking your foot off of the garden hose, and now things could start flowing properly again with her body's energetic system. When we do these surgeries, we use something called PRF. It's called platelet-rich fibrin. So we draw some blood, spin it in a centrifuge, and then we make these gels. So the blood separates, and you've got the red blood cells on the bottom, the white on the top. We only isolate the white, and then we make these wound dressings with them, and they're full of stem cells and growth factors, and so it can really accelerate and boost the healing response in these areas. So we'll put these things back into the site that we were working and then close it up. So it's like using the body's own natural products. You're making biomaterials from the patient's own body and then using those in your surgical site. And then this here is what we call sticky bone. So we actually will take bone grafting material and put them back in the site as well to help fill the space and prevent another one of those cavitations from forming. And we'll talk about that now. So it's called a socket preservation. And when you have one of these holes left over, so this is like the wisdom tooth area here, you've got like a gaping hole left over. And ideally, the body would just grow new bone and fill it all back in. If everything is perfect, that should happen. Theoretically, if the nutrition's on point, if there's not toxicities, if you are living a nice, like natural sort of lifestyle in the sun and like grounding and doing all that good stuff, like theoretically, your body should grow bone in there. You know, realistically, in today's world, it doesn't happen so frequently. And so what we typically do is put some of this bone material back into the area, and you're filling it up, and it's like an insurance policy that one of those cavitations isn't going to form again. And then over the course of 4 to 6 months, even a year or over 2 years, the body will slowly turn it over and resorb the material you put in there and then lay down new bone. And the different sources of that, we have human-derived bone, so it's called allograft. Then there's mineral matrix lab-made bone. So the two that I use are called beta TCP, so that's tricalcium phosphate. The other one's hydroxyapatite, and we'll usually mix like a 50-50 blend of those and use them. I find the human-derived one works well, but a lot of people don't like the sound of having someone else's bone used, and I totally get that. It is denatured. It's like all the cellular proteins and all that stuff is removed. It's just the like calcified structure from the bone. Then we've also got animal-derived bone, and that's called xenograft, and it's typically not recommended in biological dentistry because it is going to be foreign, very foreign material to the body, and it's going to be seen as something foreign and be a trigger to the immune system. Have you heard of the meridian? You've heard of the meridians and like so this is a cool thing that we use, and you can kind of diagnostically try to help a patient connect maybe what's going on with a certain tooth to certain systems in their body. I've got the link in the show notes for this chart that you can download yourself, and you can see, have a look at your own x-ray and see how you do that and how it correlates to different areas of your body. I want to talk to you, Dr. Smith, about vitamin D. So when I did my training, maybe we can just take this slideshow off for a minute here. But when I did my training, the biological dentists in Europe and like this whole world, we're talking about this bone healing problem. How when you have these sites that you have a tooth removed or you clean out a cavitation or whatever, you've got this hole in the bone, and you need the patient to regenerate and grow new bone. Mm-hmm. And so the biological dental world is teaching like vitamin D and K2 and magnesium is essential for this bone regeneration process. So that's how I was trained on these things. And now since studying your things, I'm questioning a lot of that stuff. And personally, I'm not using vitamin D supplements anymore. I need some of the gaps filled in for like, how are we going to help the patient regenerate their own bone? And is there any sort of merit to this idea that, yes, vitamin D helps your calcium absorption, and then magnesium and K2 help drive calcium from the blood into the bones rather than keeping it in the blood? So that's what I wanted to ask you about this.
Well, it's kind of, I mean, we get into situations where it's a literal post-surgery situation where it's a
right.
bit different. we get into, I mean, so I'll head into, I'll just go over here, I call it the 6+1 things that we do to fix calcium and magnesium balance in the body, which would then directly play into this bone healing stuff. And so when we're talking about, like, you're getting people who are obviously, they've got dental problems and they're probably quite sick in other ways. And they're probably, I mean, when you're looking at that fatty deposit, there's fatty tissue, it's yellow and it's fatty and it's toxic. Okay. So what do we get into? Well, one of the first things we do is the low vitamin A diet. So let's relate that to, if we're seeing these yellow fatty toxins in there, and vitamin D and vitamin A in the research are antagonists. So they directly fight against each other, if you will. Well, so if we already know they have, let's just assume, we're making a big assumption here, but they have vitamin A toxicity and some of it's showing up here. And that's why they didn't heal in the first place.
Yeah.
Well, that would generally mean that their vitamin D is going to be low.
Right.
So that's one situation where if they had to give it for a period of time, I mean, people don't realize that vitamin D raises your blood calcium by one of two ways, or a mixture of two ways. One, it can increase your calcium absorption from your gut, but the other one is it literally pulls calcium out of your bones.
Yeah. Yeah.
So we start going, well, I mean, yes, we do need to heal this. Are we going to pull calcium from other bones to potentially heal it? Is that better? Is that a better situation than not healing it? Probably.
Right.
Because we can always deal with that later. But so vitamin A toxicity would want to be dealt with. You're in Canada, right? So I mean, your patients and other and places up north are coming from places where they don't get much sun, and so that's obviously a trigger for. I just think vitamin D science is, the whole thing is sketchy. So whenever people claim to be vitamin D experts, I'm just like, if you don't even talk about vitamin A, you don't have anything going. Yeah. So we have the light issue. Like, humans need light. That's why we don't have much hair. That's why we're supposed to live in areas.
That's why I'm in Costa Rica right now.
Right. Yeah. So just because we can live in dreary places, doesn't mean we should. And if people choose to live there, they can't just be like, well, this is the way it is, and I don't want to go to a tanning bed. I don't want to do a spurty. I can't get out in the sun because I work in an office. Then it's like, okay, you're gonna be sick. Like,
right.
If you don't want to exercise or move your body at all, you're gonna be sick. Like, these are things that we have to do. And so we have the sunlight. Then we normally would add to that. The third one would be no vitamin D supplements. Oh, for those of you, Joe mentioned people might not know what a spurty is. A spurty is a tanning lamp or a sun lamp. They have a vitamin D lamp or they have a tanning lamp, and they're just different balances of UVA and UVB. They both work, but they're just different amounts of UVA versus UVB to make either more vitamin D.
I have both of them. That's kind of my solution. Yeah, I got both of them, and I built a little booth in a closet in my house with a vibrating plate, and just
up in Canada, you need that.
Yeah, exactly.
I mean, I was literally thinking today about if I move up to Idaho, of having a place with having my own place with like a tanning bed and like a sensory deprivation tank, but using like magnesium chloride instead of magnesium sulfate, and like all these things that would be helpful to both me and other people. The gym I have up there it's a local gym, but they have a tanning bed. And I talked to a guy about it. He said they have like the best one in town at the gym I go to. Better than the ones at the other, like the specific tanning places. But anyway, so we have low vitamin A diet. We have getting your UVB and UVA light, whether that's sunlight or otherwise. We normally don't do vitamin D supplements. And this is where we're going to get into the things that people have and they may or may not ever fix. Zinc deficiency. Zinc is critical in vitamin D metabolism. And obviously you're talking about immune regulation and other things like that. And we go, well, zinc's pretty important there too. And then we get into magnesium, which is, yes, they do magnesium, but it's getting it in there is not easy. It's not as easy as just taking pills. So that's about 5. And then we have people getting the amount of calcium that they do well with. I have that whole calcium episode that I did where like we have lots of people in the program who they tried after that video. They tried more calcium. They tried getting more calcium and they didn't feel good. I literally tried it and I don't feel good, even with all food calcium. They said, the one guy was saying he was breaking out. Other people said they got more stiff. So their digestion didn't like it. So they don't need it. But some people could do well with it, especially older folks who have already lost a fair amount of bone and then they could use some. They got to get the calcium from somewhere. So we have that. Then the 6+1, the +1 is vitamin K2 if a person shows they need it, or if they show signs of needing it, which we have like a 6-item list, I think, of that. So do the magnesium and K2, yes, I like it. Now, are people for people you're working with, are they going to do the light?
Right.
I don't know. Most people don't. I mean, it's like you mentioned sleep apnea earlier about dental problems. And what I'm finding right now, what Kelsey and I are finding, is that the amount of resistance of people even wanting to think that they might have some sleep apnea problem is off the charts. People just be like, I don't have sleep apnea. I don't have it, because they think they have to get a CPAP. And it's like, no, you just got to work on some things that breathe better at night. It's not, doesn't mean you're going to be Darth Vader at night.
Yeah.
So
exactly.
And we can find in the research magnesium deficiency and zinc deficiency and copper toxicity associated with sleep apnea. So it's like all coming from the same place. So with vitamin D, if somebody said that they were going to do, if somebody said we're going to do it for a period of time, if somebody said, I'm not going to do Dr. Camastra, I'm not going to do a tanning bed, I'm not going to do a spurty, I'm not going to get outside. And you said, okay, well, if you figured out what you think like the minimal effective dose of a vitamin D supplement to do during that for a limited amount of time. I mean, it's when we get into surgeries and stuff like that, it gets into, we are literally purposely creating wounds in the body. And especially we're creating wounds in the bone, and we may have to do things that we wouldn't normally do.
Right. And that's how I have the conversation now, is like, okay, we have this very specific goal right now, is we're doing this intervention. We need you to heal and grow new bone and grow new gums and all that. Here's a 6-month prescription essentially. And then this is not what I recommend long-term. And then I've been steering people towards Love Your Liver for like the long-term detoxification, if that's what they need, right? If they really need to detox, which most people do, right?
Most people.
Okay.
Yes. So that's my take.
That helps. Yeah, that really helps. Thank you. Because I've been like, you know how it is when you come onto new information, you're questioning the old stuff, and you're like, I got to figure out where to go with this.
I mean, we both know that if people were getting sunlight or UVB on a regular basis, we wouldn't even be discussing, like most of us, the reason we have to discuss UVB and UVA is because people are indoors all day.
Yes.
Because they're zinc deficient, and because they're magnesium deficient. Protein deficiency will cause your vitamin D levels in your system to go down. So it's all
like I had.
Go ahead.
I had a patient that one of the implants was failing, and it was loose actually. Like I saw her and I could move it was wiggling in there. And this is when I just kind of got on the vitamin D stuff. So I put her on vitamin D, brought her back in a few months. My plan was actually to take out the loose implant, because it's unheard of for a loose implant to tighten up.
Mm-hmm.
But anyway, so I was planning to take it out and put in a new one. And I was like, well, let me get you on vitamin D. I got her to get tested. She was like rickets level, right? She was like 20 nanomoles per liter, which is way low. That's like 5 nanograms per milliliter, deciliter. Yeah. And she came back for me to take the implant out and put a new one. The thing was solid. It was like, it was crazy. I was like, wow, you healed it. So yeah, it seems like for the specific, and it's someone who's super deficient, like rickets level, it's like, it might actually help them grow some bone.
Yeah. It's like I talk about with testosterone replacement for guys. Like, so if you take the testosterone, could it help their muscle growth? Could it help their libido? Could it help their confidence? Could it help all these things? Yes. But just like you're talking about with this lady, this lady made, light deficient, zinc deficient, protein deficient, magnesium deficient. Well, I've gone over the same things with testosterone too, that these things. So could the vitamin D help that set, which is your goal? Like that's your job, is to do a good job on what you do. Right. But is the vitamin D fixing the zinc deficiency, the magnesium deficiency, the protein deficiency? It's covering, it's fixing that one thing, and it's kind of covering for those other guys. But eventually, like vitamin D doesn't replace zinc. Nobody would say that. But as the zinc, what happens is often if people they fix the tooth, right? But they never addressed that festering zinc deficiency, which just
Yeah.
slowly gets worse and worse. And then it creates other problems elsewhere. And it may create another problem in the original spot.
Yeah.
So
For
anyway,
sure.
so yeah, it's just like we want to deal with all the things. And if we deal with all, if somebody were to deal with all those things that I mentioned, the vitamin D thing wouldn't be an issue. But people just literally aren't going to do it. I mean, we have
Yeah.
a guy in pain management who sends people to the Love Your Liver program all the time, and it could help them just have pain and less pain in a month. And he said not a single person has come over to do it because they just want the magic pill.
Yeah. They've
So
got to be hardcore.
yeah,
Right?
our approach is not for the what's the weekend,
Yeah.
visitors.
Right. No, I appreciate that because you know, I last thing I wanted was like, okay, someone from your world comes over to see me, and then it gets back to you. Oh, Dr. Camastra told me to take vitamin D, and don't send anyone, don't go to him, or you know what I mean. So I'm glad to that I got to have
Well,
that
just so you know what I'd ask
conversation
that
with you.
person if they said if they took it, I'd say,
Yeah,
did it help? Did it seem to help? And if they say yeah, then I say great. That's
right.
We're all about fixing that. Like that's the acute thing, right? And then we can work on the chronic thing, which may
Yeah,
not involve taking that.
right.
So
It's what is the
it's all-
goal? Yeah, what is
yes,
the goal exactly?
yes.
Cool. All right. Well, let's keep going here, and we'll
Well,
try to wrap up the presentation. Then we can talk about whatever you guys want to talk about. So we're into the degeneration section now. I'll just go very quickly through this, but this is your classic cavities or dental decay. So it's the most common problem in dentistry. Um, Teeth are these beautiful creations of nature, and they've got these intricate layers of enamel and then dentin on the inside, and then you have the nerve on the inside of that. And when you have this dental degeneration, it's literally rotting. It's an imbalance in the system such that the natural tooth structure is decaying. So I actually, it's even though it's common, I view this as a very serious problem. Like your body parts shouldn't be rotting, um, right?
well, it's
But
kind of
it's
like
so
leaving dead
common.
tooth in there. Like dentistry is such a weird thing, right? I mean, you have
Yeah,
people are literally rotting in their mouth, and then they're leaving what is basically dead tissue in the mouth. It's the only time when we leave dead tissue
yeah,
around, right? So
exactly.
anyway, keep going.
So you know, this is kind of what happens. Like it could even happen if there's like a little crack in a tooth or something, and then the microbes get in, and then they start eating away at the softer layer of tooth structure under the enamel, which is called dentin. It leads us into this tooth death cycle, right? So you know, people might not think it's a big deal to get a cavity because you can just get a filling and the cavity's gone and you go on with your life. But this is where the cycle starts with people. It starts with something small, and then you get a filling, and then the tooth is weakened, so you get little cracks and stuff like that, and then you get more problems, and you end up with a bigger restoration, like a bigger filling or a crown. And then the nerve gets upset of the tooth, and then you end up needing a root canal. This is why so many people, you look at these x-rays and they have so many root canals. It's because every root canal was a toothache, usually at some point, where the nerve of the tooth got upset and inflamed, and it doesn't come back from that generally. And then you end up with teeth being pulled and you have an implant. So this is the tooth death cycle. So the second you drill into, when you do a cavity, you drill into that beautiful natural tooth structure, you're compromising that structure. It's kind of why I was saying when we were talking about the bridges earlier, I'm like yes, it's an option, but it comes at a price, right? And um, so I won't spend too much more time on this, but there's this whole area of biomimetic dentistry. And so there's dentists who've done training in this area, and it's looking at how do we restore teeth from not using the most natural principles and in restoring the structural integrity such that the teeth aren't likely to crack and need problems again. It's like if you need a filling or you need a crown or whatever, and you follow these principles, it's the least chance of that tooth having a problem again in the future. Um, all the causes of dental decay, I don't think I need to go too much into this, but they're highly mineralized structures, teeth, and they can demineralize if the chemistry is off, and so your body is leaching minerals from the tooth. And I think sometimes it lends itself to that conversation about deficiencies, because your body can get minerals out of the teeth and even the bones and stuff. And so my favorite example is in pregnancy. You see women who never had a problem, never had a cavity, and then after their pregnancy, they come back and they've got like a mouthful of cavities, or maybe it's after the second kid, and it's depletion.
Mhm.
Um, that's I have these moms that I know that they eat very healthy. They're not eating junk food. They're not doing the stuff that normally you'd associate with getting cavities. Yet after pregnancy, they come back and their teeth are starting to demineralize quite considerably. So I think that's really interesting. Like the old way of talking about it was like, yeah, you just don't brush and floss enough, and maybe there's acid, or like you drinking too many acidic beverages and stuff. So those things are all contributors, but there's a lot more deeper things going on. Mouth breathing is one of the big ones. So the saliva is like nature's toothpaste, and
Mhm.
when you mouth breathe, your mouth dries out, and then your teeth aren't bathing in that healthy nutritious fluid, which is saliva. Um, I've
Actually,
done,
can I add something?
yeah, of course,
Yeah.
yeah,
People can go in the research and you can look at Accutane. And Accutane has actually been shown in the research. So vitamin A, as the most active form of vitamin A, has been shown to decrease saliva production. And they could literally show that cavities and dental problems went way up during and after taking Accutane, simply from the reduction in saliva, not even getting into the whole bile and saliva,
right.
all that stuff. But yeah, vitamin A toxicity. So the vitamin A toxicity can cause the saliva reduction. And then, as you were mentioning about the mouth breathing, this is why, again, sleep apnea, folks. This is why we're going to talk about it a lot here. That's a lot of mouth breathing is going on with sleep apnea, and you don't know what's happening. So I love when people tell me they don't have it, and I'm like, "Can you watch yourself while you're sleeping?" And they go, "No," and I go, "Okay, so you don't know if you have it, and if you don't want to go do a sleep study, probably the safest thing that we're going to do is assume you have it and just start doing things to make it less." And then all of a sudden they start sleeping better and feeling better, and it's
There's
amazing.
those apps too. Like there's one called Sleep Cycle,
Mhm.
and it's cheap. I don't know if it's like $5, and you put your phone on airplane mode on your
Mhm.
bedside table, and then it'll record you. It's quite interesting, the information that comes out. It'll record you snoring and stuff like that. So it can be like a little cheap at home sleep study.
Awesome.
And um, yeah, that's called Sleep Cycle.
I will look
But
into.
yeah, um, and what? Oh, yeah. All pharmaceuticals are notorious. Even in conventional dentistry, we're taught that pharmaceuticals disrupt salivary flow, and then people who are on multiple pharmaceuticals, they're very cavity prone.
I
So
actually
that's
think
even, yeah,
what I learned was that the most common side effect across all pharmaceuticals was dry mouth.
yeah,
Yeah.
exactly, exactly. And there's nothing like you get those patients who are on lots of pharmaceuticals. There's nothing you can do. You just keep patching the teeth, and they come back every time they've got more holes in their teeth, and it's it's very hard to do anything about.
It's gotta be
Um,
depressing.
yeah, that's why I'm way more fulfilled with the kind of stuff I'm doing, because I get people who are very engaged with their own health journey, and that's how I define the relationship. Is it's a partnership. Like I got to do my part, you got to do your part too, and then we can work together. And so it's way more fulfilling working with these kinds of people who are willing to do the work on their end as well. Um, so yeah, I do a monthly live call. I actually had another one last night. So I did the one last month in February was all about this topic of preventing cavities. So I've got links to all of that, um, and a couple of videos I did on mouth breathing and how to improve your breathing strategy. So I've got my whole sleep system, and then some exercise, because the problem, you get into things like mouth taping and stuff, and some
Mhm.
people still don't have that tongue seal. Their mouth will be taped, but their tongue will still fall off of the roof of their mouth, and then it can still fall back in the throat and have those same issues of snoring and all of that. So
Mhm.
yeah, I have a video here on like tongue exercises and mouth exercises to help improve that tone of the tongue to help the seal. Then there's the whole gum and bone degeneration problem, so periodontal disease or gum disease. I put it in the degeneration category. It's like how teeth are degenerating and leaching minerals and all of that. Same sort of thing happens in the gums, where the actual bony support around the teeth, which is locking the teeth into the jawbone, it becomes very compromised. And then you get this same appearance where you can see all the bone loss, and then teeth actually start to get loose. So this is another example of that. You get this, you can see like recession. You may have heard the term gum recession, bone recession. So it's just, this is a common thing we see in patients as well. Kind of, you've got like a healthy situation here, and then this inflammatory process, and then it just starts to further and further degenerate. And it's really hard to treat this stuff once it gets going. So it's another reason why you just want to stay on top of your health and the deficiencies and toxicities and stuff, because once you start having these problems, it's a slippery slope, and like there's no magic to be able to reverse this stuff and fix it. Like you end up pulling teeth and getting into dentures and implants and all of that stuff. Okay, I like to stress that it's not genetic. That's kind of the common thing that just patients get told by dentists is, yeah, it's just your genetics. And I think that's a common theme across all the health areas, where I just don't, even if there is a genetic component, I just don't see how it's helpful to like, it's not helpful. There's nothing you can, oh, by the way, there's nothing you can do. But no, there are things you can do, even
Well,
if you're a little bit more, yeah.
for the dentists who do it, it may be helpful for their pocketbook.
Yeah,
'Cause
yeah,
say
exactly.
you can't do anything
Yeah.
about it, so just keep
Yeah.
doing the same stuff that has you
Yeah.
coming in here every 6 months
Yeah.
to get your teeth fixed, you know?
Yeah.
So
I think the protein really comes in on this one too, because it's just how your body builds new tissue and maintains its tissue. If you are deficient in protein, I don't know what can your body use to build. And then your body's never against you. The mouth is actually, if you're deficient, the mouth is actually a really good place to borrow from, to use in other places, because you're not going to die from losing a tooth or whatever. If you have bone loss, you know, decalcification of your femur bone, and you break your leg, you're kind of screwed. But so the body is intelligent, and it's selecting areas that it can get nutrients to meet its physiological needs, right? So it's actually a very interesting design. There is this new advancement in dental cleaning technology. It's called guided biofilm therapy. This device comes out of Switzerland. And on the right here, you can see there's a powder spray coming, and that is what's used to clean the teeth. So it's a lot more gentle than the traditional instruments, which are being showed in this video here, of a lot of the scraping and the instruments that are used that can actually be damaging and remove enamel and damage the gum. So this is what I've brought into the clinic now, and I find it's a big improvement on teeth cleaning. That's it on the degeneration topic. I don't know if there's anything you want to linger on here, but we can start to get into some of the structure stuff if you want.
yeah, take it wherever you want to take it.
Okay. So I frame this from a growth and development standpoint, because like your current structure is a product of your growth and development. When we look at the human skull and all the different bones that are there, you've got the maxilla and the mandible, those are the jaw bones. And then you've got the TMJ, where the mandible articulates with the base of the skull. What I like to show on this image here is that you've got room for all the teeth, right? So you've got 3 molars. The wisdom teeth would be the back ones. And in a properly developed skull that developed to its full potential, you would have room for all of the teeth. You wouldn't be talking about things like braces to straighten the teeth and wisdom teeth extractions. You just would have grown properly, and there'd be room for all your teeth. They wouldn't be crowded or not coming out at all. So this x-ray, it's actually my own mouth. I'm fortunate. My parents didn't do anything special. I have my wisdom teeth. So you can see all 3 molars on all 4 quadrants. fully grown in, and they're functional. They're in my bite. This is really how people's mouths should look. If they, and I actually didn't grow enough either. I've got some growth deficiency going on too. Fortunately, I had enough room for all my wisdom teeth to come in. You can see that that was my root canal I had on my front tooth that I got treated. This is more what we typically see these days. So
Oof.
you can see that wisdom teeth, this is called wisdom tooth impaction. So they're impacted within the bone. They didn't have enough room to come out. You can see the angle, the ramp of the mandible here. It starts ramping up. So there's no room for that tooth to come in, versus see where mine ramps up. It's way behind that last wisdom tooth. So this is the problem that we're faced with today. And then you get into conversations about, oh, is it good to have your wisdom teeth out, or is it bad? The problem is you don't have another choice sometimes. These become problematic in people, and you even if you rather not extract them, they're starting to cause issues, and you're left with no other choice than to pull them out. And so in this case, sorry, let me digress. So why does this happen? It's your buddy Weston Price.
Mm-hmm.
He actually did great work in this area. I think his observations were really good. His conclusions are where I think he was off, right? It was like missing nutrients and stuff.
Well,
But
soft foods too.
Exactly.
This is the only thing that could have changed that quick, would have been soft foods.
Exactly. You nailed it. Yeah. And so that was the major change in the diet. Is all of the more ancestral type people, they're not on a soft diet. We didn't have soft diets until the Industrial Revolution. And there's been other people who have done work on this. So this guy's amazing, Dr. Robert Corricini, and he's got it right. It's about the consistency of the food. And so there's someone other than Weston Price that's done work on this too. So we've got kind of on the left here is kind of more of the ideal situation for jaw development. And then on the right, we've got the things that are more common that lead to underdevelopment of the jaws. So breastfeeding is super important as an early stimulus for proper jaw growth. It takes a lot of effort for a baby to remove breast milk from a breast. So rather than a bottle is like kind of easy to get the milk out. And then a cool conversation is that before we had refrigeration, we would have had to preserve meats and stuff like that using smoking. And so you'd have these really tough, leathery types of jerky and stuff where you'd be gnawing on it. And like that stimulus, if you've ever chewed on something really dense, like even like stale bread, you feel that tiredness in your jaw. And that's actually the level of stimulation that those muscles need to influence the growth of the system. And unfortunately, most kids these days are raised on these pureed foods, and there's even these like pouches and packets and stuff, these convenience foods, and it's just like liquid. It's a liquid diet essentially. And so what you said before, the soft food is the only thing that could have changed that quick. Like it can't be genetic, because the grandparents had fully grown jaws, wide faces, spaces between the teeth, and then the parents were a little more crowded, and the grandkids are like modern people today. So that right there tells you that like it's not genetic, right?
Yeah.
So this is what a properly developing kid's teeth should look like. So these are all the baby teeth, and you have spaces in between all the teeth. When those adult teeth come down, adult teeth are larger than baby teeth, and that space is needed so that there's room for all the teeth. A lot of kids these days, their mouths look like this, and they've got this beautiful smile. Their teeth are perfectly lined up, and it looks like a beautiful smile. The problem is those larger teeth have nowhere to come into, and then you get like this kind of situation where it's like a jumbled up mess. And this is severe, but like most people these days have some variation of this where they end up, that's why you get told you need braces, right? So yeah, like the spacing between the child's teeth lead to straight adult teeth, versus no spacing lead to crooked adult teeth. The ideal situation, you have no need for braces or wisdom tooth extraction. You'd have a healthy airway and breathing. lower risk of TMJ issues, ear infections, dental issues, all that stuff is connected. And, you know, on the contrary, these patients end up needing braces, wisdom teeth extraction. They can have the airway, breathing issues, sleep apnea, and then TMJ issues, ear infections, and dental issues, including cavities. I wrote this little summary of 6 steps to growing healthy faces. So it starts with optimal nutrition of the mother before, during, and after pregnancy. That's like Love Your Liver Central, right? Then breastfeeding at least 18 months is good. You don't have to exclusively, like, I think around 6 months is when you would introduce solid foods. I would skip the purees and the baby foods altogether. It's not a normal thing for humans to be eating. And just to go back, there was a book I showed there. It's called Baby Led Weaning. That's kind of in the circles where I've learned this stuff. That book is recommended of like how to introduce solid foods to your kid. No pureed baby foods, and then nose breathing. A lot of kids get stuffed up often, and then they compensate by breathing through their mouth. And so there's a lot of strategies that can be done to encourage healthy nose breathing. So just like blowing your nose is one of them, or your kid like having them blow their nose and clear things out. And then there's these nasal rinses and neti pots and stuff like that. So it's super important if your kid is stuffed up to help them be clearing their nose out so they can keep that proper breathing posture. And then nutrition of the growing child, and then eat foods that require effort to chew. I just saw this on Instagram, this beef jerky gun, and you can make your own jerky at home. So I'm definitely going to order one of these and try this out. As you know, a lot of the jerkies have kind of crap ingredients in them and stuff. And so, yeah, I just thought this was really cool. I would say if you try this, try to like cook it. Like if you have a smoker or something, do it longer to actually make it tough and make it tough to chew. And then you got yourself a little bit of a myofunctional device to help with your jaw development. For kids, we've got different things available. Ken actually mentioned the MyoBrace in your talk with him. That's what he did with his kid. So there's these devices that are designed to help encourage the jaw growth and development. You have to find a practitioner who is well versed in these areas. And I would say it's more important to find the good practitioner who does this and has success with kids and patients, rather than like, which device do I use? So yeah, I've got some places like directories and stuff where you can look for practitioners for this kind of thing. And very important that it's done in conjunction with myofunctional therapy, and craniosacral therapy is really good too, as you guys were talking about the manipulation of the bones that keeps things open and allowed to move and grow. I did a live stream with the myofunctional therapist, my friend Alex Clinton. That was beginning of January. So there's a whole like hour and a half long conversation with her that you guys can check out. This is Airway Health Solutions. They are doing the best work, in my opinion, of teaching dentists and hygienists and all these dental practitioners about this area of the jaw growth and fixing these things. So they did this really good live stream. It's a parents' town hall, so I've got a link for that. This one was really good. This book is good too if you're into reading and you want to pick up a book on this. It's called Jaws. We can talk about wisdom teeth quickly. I did my stream last night was all about wisdom teeth, so that's on my playlist of all my streams too. Actually, I haven't uploaded it yet, but it'll be up in the next couple of days. This is what it's supposed to look like, where wisdom teeth had enough room to grow in fully. This is more typically what we see. And when you have this kind of situation, it becomes a trap, and it's impossible to keep it clean. And so stuff from the mouth, food and microbes and all this stuff.
Am I back?
Hey.
Oh, you guys lost me? Was that what happened? Did I disappear?
I saw you drop off.
Okay.
Was I good? Everyone could hear me?
You just disappeared for a while, Garrett.
Sorry, Joe.
Okay.
Joe knows. Like I was just sitting there talking, and it looked to me like Julian, like you froze. And then I tried to send Joe a message and then my Telegram wasn't sending it. Like it was just spinning. And I was like, wait, okay, maybe I'm the guy who got lost.
You disappeared. I kept talking. So
Yeah.
Okay, well, cool. Then just keep going from where
Yeah,
you
yeah.
are then.
Yeah.
Okay.
So this is, Garrett, I showed, sorry, I showed this image here, which shows the wisdom teeth like fully grown in.
Mm-hmm.
And they've got healthy tissue around them, and you've got a nice seal of keratinized tissue. When you have the situation where there's not enough room for them, they're just like, they can be like this, where they're just poking through, and then they don't have a good tissue seal, and so stuff is just prone to getting in there, and it's very hard to keep clean. And then this is where patients can start having inflammation and a lot of pain, and like a low-grade infection and irritation in that area. And then that's why you end up taking out a lot of these teeth, right? Because they're actually symptomatic. It's not just seeing the x-ray and saying, yep, we got to take them out. That's what happened in this patient's case, where the seal wasn't good and he was getting a lot of irritation in this area. So we took that tooth out. Here's one of the scans that we take. It's the cone beam CT scan. So we're able to, in 3 dimensions, visualize that tooth and look at its relationship to the nerve. So I've highlighted the nerve here, and we want to know where those structures are. One of the risks of wisdom tooth extraction is you cause damage to the nerve. And so in his case, that tooth is lying directly on top of the nerve, and we've got to be very careful as we're removing it in order to prevent any damage to the nerve, because someone can get like a long-term paresthesia if you do damage it. We're back to the same thing we talked about with the cavitations, where if you're left with that hole, you want to do everything you can to get it to heal properly. So this is the biological tooth removal strategy here, where we do all these things to try to get that patient to heal and grow new bone in the area. We also call it like a bone healing protocol. So I don't think I need to read through this stuff, but you see the picture of the PRF there. We also use things like ozone, and we use ultrasonic devices to clean out the socket. So there's all these extra things that can be done by the dentist or the surgeon, who can do their part, and then we ask the patients to do their part after, in following the right nutritional protocol and all of that in order to heal. So let's say you have a kid and they're going to get their wisdom teeth out, and you're just going to go to the local oral surgeon to have it done. The number one thing to ask for is just to see if they'll bone graft it for you. They don't offer that typically because it's more expensive. In my opinion, it's worth it. And so that's my one tip. If you aren't going to go see a biological dentist for that procedure, just ask for a bone graft, and that should prevent that cavitation from forming. Do all impacted wisdom teeth need to be extracted? The short answer is no, but it's kind of like there's different situations that we get into, like the one I showed before, where it's partially impacted and you've got this opening and stuff can get in. If you have something like this, where it's completely impacted, like a full bony impaction, the seal is intact. And so usually you can just leave those unless they start to become a problem. Like you can still get symptoms and pain, and sometimes they'll start trying to erupt and they'll push into the tooth in front and cause resorption of the root in front. So there's a lot of different situations. You can't make any blanket statements about like, yes, you should get yours out. No, you shouldn't. It's very individualized as per the situation of that exact tooth. We've got the next topic is occlusal dysfunction, things like teeth grinding, bite imbalances. So I think this is what you said your dad was like. He ground all the enamel off of his teeth, right? So we see things like this, and where the enamel here is all gone. The outer rim, that's the enamel, and then that's the dentin, the softer layer underneath. So this patient's worn completely through his tooth structure. And the thinking now, I know like there's toxicity component too, can be related to teeth grinding. I've talked to Beth about that. That seemed to be her experience, and that got better for her. But there's the airway thing too. If the airway, if the jaws are too small, the body is kind of like fighting for air. And one of the things it does is like tense up, and it it pulls open the soft tissue and can like open the airway. So it's like it's a compensation to this underdevelopment and airway collapse. So fortunately, we can fix these things these days and rebuild people's mouths and teeth. So here's a reconstruction that we did for this patient. We'll get into a little bit about bite. So you and Ken were talking about this, the way the teeth relate to each other when you bite down. Normally, the teeth are supposed to intimately fit together, kind of like a puzzle piece, and we call this intercuspation. And people lose that. Like if you get into a situation like this, everything's been worn away, and then it's more just like a flat kind of thing that they can slide around on. But the problem with like getting, like, let's say like me, for example, I have a really good bite. My teeth all fit together really well. And I'm very cautious about messing with that, because if you throw the bite off, it can cause other problems for patients. So it's like having a pebble in your shoe. Sometimes the smallest thing can throw off that system. And we've all probably felt it, like if you have like a raspberry seed or something, it's the tiniest thing and you can feel it in your bite, and you bite down and you're like, like my teeth won't come together properly. Some people can compensate and adapt to that really well and easily, and others, it can ruin them. They can start having headaches and having all these problems. And dentists learn this very early on in their dental career, because you do a filling or something on a patient, and then that patient comes back and they're like, I'm in so much pain, I can't eat, I can't chew, and it's because the filling was made too high, and so it's in the way of the bite. And then you go and you adjust it and you shave down that filling a little bit, their teeth come together properly, and then they get better. So I'm very, like, I hear about, I haven't tried the Revive Guard myself, and I'm sure it's been amazing for a lot of people. The one thing that like I am a little concerned about is if your teeth start to move because the bones start expanding, and then it throws off the way the teeth come together, and that puzzle piece formation. For some people, they'll be able to adapt and compensate well with that, and for others, it's going to throw them off and it's going to lead to more problems. So that's my one hesitation with things like that. This is a really cool study that they introduced a bite interference in a rat, and you can see it changed. It caused like a scoliosis, and it's like that pebble in the shoe. If you had a pebble in your shoe, does it change the way you walk? Well, yes, it does. And it's the same with the bite. It changes the balance of the skeletal and neuromuscular system such that it can throw the whole thing off. And this has been shown in human studies too. This stuff gets really complicated with the cranial bones and the muscles and the pairs of muscles and all of that. There's a whole side of dentistry called neuromuscular dentistry that focuses on all of this. These are my wife's teeth. My wife had braces twice. She had regular braces when she was younger, and then she had Invisalign when she was older because she wanted straight teeth. They told her bite was off. She said, I don't care, I just want straight teeth. And you can see her teeth don't come together. This is her biting, and she only touches in the very back, but her other teeth, they don't come together. She's lucky. She doesn't have headaches. She doesn't have those kind of issues, but some patients do. And we see a lot of people that once their bite is off, they're like not compensating very well at all. So in this neuromuscular dentistry area, you can use instrumentation like TENS. You can do tensing on the muscles, and it causes the muscles to be relaxed, and it gets things into the position where the muscles are calm. And then you can do EMG and measure the muscle activity. And so you can find the position of the jaw where the muscles are the happiest. So the problem, like you can see she's biting, and then we're measuring the muscle activity there. The problem comes when, like, a dentist gives you like a night guard or like a bite appliance or something like that, and when you don't know what's happening with the muscles, you can end up putting the jaw in a position where the muscles get overactive. And so, like in a case like this, you've got a night guard in here, and then the muscles are just off the charts. They're like very unhappy, and that actually causes more grinding and clenching and that kind of stuff. When you do it using the instrumentation and you measure the muscle activity, you can find the position where it's about the length of the muscle, right? And like the way the actin and myosin fibers overlap, the position has a physiological outcome. And so something like this, the muscles are a lot quieter. And so I haven't really seen another way to accomplish this without actually being able to measure the muscle activity. This is Dr. Bob Clinton. He is a mentor of mine. He and I actually, he had a lot of the toxicity stuff in his mouth. He and I went to Germany when I was doing the training, and me and the surgeon there, we did his whole mouth surgery. And then Dr. Clinton is all into this neuromuscular stuff. Oh, I hear it. Oh, sorry. And his daughter is the one who's the myofunctional therapist that I interviewed 2 months ago. So he can go on for days. These are his slides that I borrowed and this stuff. And he might be someone, I got him into the vitamin A stuff. He's a really open-minded guy. He might even want to come on sometime and share like more detail about this stuff if you want to have him. There's devices called the myo-aligner, and that's taking this whole neuromuscular thing into account, where instead of having a guard that goes into your mouth, you get these little inserts that can like this, that can go sit on over top of the teeth, and it can be more comfortable. Some people can't tolerate some of those guards in their mouth. It's just too uncomfortable for them. So there are other solutions out there that are a little more sleek, and you can eat with these and you can like live your life with them. I'm actually going to be doing the training with this doctor here. She's brilliant. She invented this thing called the myo-aligner. Here's a webinar that she recently did. It was more geared for dentists, but I think some more astute, love your liver type people might find it good. And we get into this whole biting on the back teeth topic. Being able to bite on your back teeth is like being able to put your feet on the ground. And so a lot of patients, when they've lost too many teeth, they lose that molar contact. Mm-hmm. And I get patients like this who come to see me and they want me to take out the root canals and stuff. And then I've got to be very careful because this is all she's got. She doesn't have anything to bite with on the right side anymore. And this is the patient looking back at us. So this is actually the right, this is the left. And so if I take out all these root canal teeth, she's going to have no bite on both sides. And by trying to remove toxicity in this person, I could end up triggering a neuromuscular problem and, asking for more trouble. So it's really important in some patients to re-achieve that bite stability when you're trying to do some of these reconstructions. And just to throw a wrench in all of this, after we think we're getting onto some truth and everything, I was looking for this video over the weekend because I remembered seeing it like 4 years ago of this guy, this farmer with one arm and one leg, and he's doing all kinds of things. And to top it off, what is he farming?
Sweet potatoes.
Sweet potatoes. And like, it's just to illustrate that we can nerd out on all these things and all these problems that people have, and like humans are supposed to be really resilient. And I think if we just spent a little less time on our devices and a little more time outside, and a lot of these things we wouldn't even need to talk about them. But just the bite thing, it's some people are very easily, they can adapt it. I think Ken is like that. He was talking about how he had resins and stuff put on his teeth to change the bite and whatever, and like never caused a problem. A lot of people are in that camp, and you can do that stuff to them and they're going to be fine. Other ones, just the littlest change in their bite is going to send them into a negative spiral, and like they thought they had problems before, and like there's a whole new world of problems awaiting for them. They go into like a crisis mode. So yeah, that's it. This is my monthly Q&A that I run. It's $40 for the year. It's talking-teeth.com if you want to come on. This is kind of how I make myself accessible to just anyone out there who wants to ask me whatever dental questions they want. I do it the first Mondays of every month. Here's the clinic that I built. We built an IV lounge in the clinic, kind of the stuff I showed you that I had done to myself in Switzerland. This is what we're doing. So patients get a massage and everything before their surgery. We've got the PEMF device. We're doing IVs to support the healing and recovery. We find that swelling and pain and all of those things are way, way lower when we do supportive IV therapy. So I've partnered with a naturopathic doctor who handles that part of things for me. There's cool stuff like this, where this is just a device that chills water and you wear a mask. And so instead of ice, like an ice pack, this cools the water to 17 degrees Celsius, and that reduces inflammation and swelling and pain, but it doesn't limit blood flow. So you can wear it, you can sleep with it on. So we do all these extra things with our patients, red light therapy, all that stuff. We've got a hyperbaric oxygen chamber that patients go in every single day, the week of their surgery. So yeah, just thought it was cool to share some of the stuff that we're doing. Here's all our stuff about the clinic and all this stuff. And yeah, that's it.
Awesome. Well,
thanks.
We got enough questions, I think, with the super chats that I'm not gonna. And you kind of covered some of the stuff about the mouth guard stuff.
Yeah, I mean, I listened to enough of your stuff that I was like, all these questions keep coming up. Missing teeth and all this, wisdom teeth, all that stuff. So I was like, let me like put something together for your audience that is going to be a valuable resource, and then hopefully maybe save you some time in the future too with some of these questions that you get.
Well, I think other people have a question about this, but I want to ask for somebody very dear to me. So if somebody wanted to get, like, if they wanted a second opinion or a first opinion from you, and they wanted to get as much in, virtually, obviously, let's say they can't visit you for the opinion, but what kind of imaging do you want? What would be optimal for you to have that, like, let's say an American can get, somewhere relatively normal to send to you to, like, or do you do virtual second opinions and stuff like that?
So that monthly thing that I do, I also have an option to book a virtual consult with me.
Okay.
So you can book like a 30-minute or a 60-minute thing. And so I'm available for that. And almost everything we can do from the panoramic x-ray. So that's the 2-dimensional one that I showed at the beginning. And I generally prefer that's what people get, because you can get that taken anywhere. I don't love when someone goes and gets a 3D scan and sends it to me, because there's all these software compatibility issues. And so you think you're doing a good thing by going to get the 3D scan taken and then sending it to me, and then I'm like, yeah, I can't open it. Like it's like iPhones and Androids, but it's like multiply that by 10. So I generally tell people, just get the 2-dimensional one. You start there. You can have a lot of good conversation. You talk about 95% of what's going on, and then in certain cases you might need the 3D, and then that's when you would advise someone to go get the 3D. But yeah, so I think that answers that question. Right?
Yeah. Awesome. Okay, so let me get to the super chat from last week. Joe, the CEW's super chat, if you want to bring that up. The 2 colored super chats from last week that I posted in the group chat.
I think I have them here too.
You have them? Okay. Well, I can read them if you want for now until Joe can bring them up. It was 2 molars in the back top left of mouth are crowned and ache when food is stuck between them. Always bleed when flossed. Just pull them as a question. Can roof mouth collapse or okay to leave empty? What should he do? And that's one question. And then the other one is left submandibular gland has a lump along with recurring tonsillitis on the same side. Seems to possibly be due to a poor crown I had to get replaced in the same upper left spot. New crowns, but still has the issue mentioned in the chat right before that, what we talked about before. So
yeah, it sounds like when you make a crown, contour is very important. So it's essentially how the crown fits in the gums. And so if the shape of the crown isn't so good, it can make it prone to food trapping. So it doesn't sound like there's a problem with this person's teeth. It sounds like the way the crown was designed, food is getting stuck in there, and then that's when it starts to ache and have a problem. So a lot of times you can just remake the crowns, have them be shaped a little bit better so that food doesn't get stuck, and then you're fine, and you don't like it's a little extreme at this point to be talking about pulling teeth and stuff. It doesn't sound like there's a problem with the teeth. So yeah, a lot of times you can just redo the crowns, make them a better shape, and you're fine. Okay. You might need someone else to redo the crown because it sounds like the person who did it might. but I mean, it's happened to me. I don't like to talk bad about dentists because I've had cases too where someone's getting food stuck, and then my policy is like, tell me, and then I'll remake it for you if you're having that problem.
Mm-hmm. Okay, so then the next one was that the submandibular gland.
Yeah. I don't see how that can be connected. Yeah, I don't really see how that would be connected with like a lump in a gland with a poor fitting crown.
Okay.
So yeah, I wouldn't be so convinced that the crown is the cause of that problem.
Okay. Well, he's been working on the Love Your Liver stuff, and he's improving in a lot of ways. So
yeah,
who knows what I mean, we've had people with people ask about swollen lymph glands and hard lymph glands, and they say, what do I do about it? And you can do the lymphatic stuff, in my opinion. Of course, if there's some source of something like a cavitation or something that's a toxicity leaking, then yeah, that would be good to deal with. But usually the lymphatic system just moves better as people get less toxic. But obviously the source, we want to figure out the source if we can. Like my buddy in medical school, in ND now, he had lots of hard lymph nodes in his neck. And finally, I just said to him, I'm like, dude, you smoke. Like, you're literally sucking poisons down your neck and it's getting caught there, is my opinion. I think if you stop smoking, I think that would all go away. So anyway, so I guess that's what we've got on that one. Let me see the other one. Joe, if you want to bring up those pictures, I will read the info. So Joe, this is the woman's pictures. Okay, so here we go. 2 years ago, the mercury filling in tooth number 13 broke off down to the gum line on the backside of the tooth. This left the root exposed and the only option to extract the tooth. This meant, of course, that my option for replacement was either a bridge or an implant. While waiting to choose the procedure, the dentist I was seeing said they could do safe mercury removals on the multiple remaining mercury fillings in my mouth. They did the 2 teeth in the back next to the one that was extracted, numbers 14 and 15. So wisdom tooth 16 is already gone since my early 20s, right? So now we got 14, 15, 16 gone. They did not use IAOMT safe mercury removal procedures and ended up killing those 2 teeth, requiring root canal or extraction. I chose extraction. Since then, I have found a wonderful holistic cosmetic and restorative dentist who removed all remaining mercury fillings. Here we go. Here's the question. My dilemma in question is, it has already been almost 2 years since the loss of those 3 chewing teeth, so I can't chew on that side. I can already see some muscle loss in my apple cheek on that side. So that's why she sent the pictures. I imagine I can't go through the rest of my life. I'm 55 without chewing on that side. There are no other teeth beyond number 12. What are my options to prevent bone loss and muscle loss? Zirconia implant or dentures or what? Is zirconia fairly benign or is there a risk of causing health problems? So there you go.
Yeah, I think we answered that.
Yeah.
So personally, I would recommend the zirconia implant, and that's what I chose for my own mouth. And I see patients get better after, like, you take out the stuff that shouldn't be there, you put the zirconia implants in, and then their health improves. So that's really good confirmation for me that what we put in there is agreeing well with the system. Then it is more, it's the most expensive option. So there's that. So that's why there's those like removable, like the Valplast denture thing that I showed. But at 55 years old, I generally recommend like, yeah, you know, hopefully you're here another 40 years, like 45 years. And so like you want to, if you can do it, you have a better quality of life if you're able to chew with both sides.
Right.
Things collapse, right? When you lose teeth in the back, then like your whole face can sort of start to collapse. You see elderly people and like that have dentures and their lips are all collapsed around the corners of their mouth. You know that look? Yeah.
Yeah. Okay, well, I think I'll just read the super chat from LeBrad Pass. He's a regular super chatter. He says, "What would you?" I think you already answered this, but what would you suggest to replace a root canal / implant?
Yeah, generally the ceramic implant.
Yeah. Okay, so let's go down here. Oh, we did. So Sandy, that was Sandy Jo Foreman. That was her question. So she was asked. That's the same person we just went over. So we got that done. So thank you for those super chats, LeBrad and Sandy. And then Houndjog says, "Hi, I have a hole in my back tooth, but the dentist can never find a cavity. Is it better to fill the hole, or is it okay to just leave it? Thank you."
It sounds like it's just the natural anatomy of some people's teeth. Their natural anatomy, just they have very deep grooves of the teeth, and so they naturally like trap food and stuff. So like the most conservative thing to do is just live with it. If there's no cavity, like there's no tooth decay under it, then you're fine. But if it bothers you and it's annoying, then you can get a little filling put in there. They wouldn't have to drill out too much of the tooth, so you can get it kind of like sealed off a little bit, so it's not as much of a food trap.
Cool. Yeah.
Yeah.
Or like the, what is it? I don't know if they call it the ceramic or the porcelain filling, where they fill in the deep grooves.
Yeah, sealants. They call it sealants. That's what they do on kids.
Okay.
It's usually
I just remember they had ones that were like less. I'm totally uneducated. Like ones that were a little bit less plasticky, I guess.
Yeah. Right.
Like,
yeah.
Right.
So there's one. Yeah, we use one. So like there's BPA and stuff in the dental material. Yeah. And so there are some BPA-free filling materials. There's one, the one we use is called Admira, and it's a ceramic composite, so it's a hybrid. And so yeah, it's like generally a healthier, but like people get a little bit too hung up on that stuff. The BPA is like 100 times less toxic than mercury, so you're still going in the right direction. It's not. Right. Yeah.
What I tell people about BPA is people got upset about BPA, so then they changed to something new, some new what do they call them, plasticizers or whatever. Yeah. So they use the new ones where they don't have research, so nobody says it's bad yet. They're like, it's less bad, but that's because there's less research.
Yeah, it's like BIS GMA. That's another one. Yeah.
Okay. So let me hit on another question. I think this one I might be able to do more on. It was, so that's all the super chats for now. So Cassidy said, Cassidy 1611 said, how would you remineralize cavities? You might want to answer that one after, but here we go. After 3 babies, I keep getting more with each pregnancy. You kind of mentioned that.
Yeah.
I think it's because my acid reflux that gets really bad in the 3rd trimester. Well, let me do mine, and then I'll let you hit yours. Yeah. So Cassidy, I was saying this was actually when I disappeared. I didn't know you guys were still on, so I started answering this question, I guess, all alone in here talking to myself, but we'll do it again. So Cassidy, if you haven't seen the reflux episode, the GERD and reflux episode I did, it's really important because reflux that's why they stopped calling it acid reflux. They started calling it gastroesophageal reflux disease, is because there's always bile in it. There's always bile coming back up. There's not always stomach acid, a lot of acid, but there's always bile. So it's either bile without acid or it's bile with acid. So the acid one is the worst. And that's Dr. Camastra was talking about how it can, add too much acidity in your mouth can definitely demineralize teeth. But the bile coming up, that's just showing like you're definitely, well, okay. So kind of like I talked about, when the bile issue is not dealt with, the cholestasis, the leaky bile is not dealt with, it's going to generally get worse because it's like self-propagating. It's kind of like what Dr. Camastra was talking about, these tooth infections. They get worse because the bacteria that are in there that nothing can get to, they just keep making more bacteria and making more toxins. And then you have more and more health problems. So this bile problem, if it's not dealt with, it's kind of like the vitamin D thing. If the vitamin D problem is coming from zinc deficiency, protein deficiency, magnesium deficiency, light deficiency, and you don't deal with those things, yeah, you can band-aid it, but it doesn't ever really go away. So I would, in between pregnancies, in my world with what I do, I would really be working the Love Your Liver program and getting your liver better and your bile less toxic. So that the plan would be the next time you are pregnant, we're not leaking as much bile. I mean, I've been over the research before where they say that it was in a research paper where it's quoted that subclinical cholestasis, like subclinical toxic leaky bile, is now considered normal in pregnancy. So that's absolutely normal, and that's the itching of pregnancy, that's the GERD, that's all that stuff. So that from my angle, that's what I would work on. In terms of, I'll let Dr. Camastra talk about remineralizing cavities and stuff like that. But in terms of the cause of it that I think might be happening, I mean, yes, there could be, you may need some more calcium during pregnancy. You may need to eat more calcium foods and do some of that stuff. And the other things I mentioned about the calcium and magnesium, the 6+1 things earlier, but now I'll let Dr. Camastra talk.
Yeah, thanks. So it really depends on the severity of a cavity on whether or not it can be remineralized or not. If it's in the outer layer in the enamel, then generally it can be arrested and then even remineralized. Once it gets into that soft underlayer, it's kind of at the point where it needs to be intervened with. So definitely you should watch that stream I did on preventing cavities, and I go deep on all that stuff and all these strategies that you can do to try to reverse that problem. There's like gums that you can chew. There's one called, I'll think of it, but even like you can floss iodine between the teeth. That can help arrest a cavity. So there's like the hydroxyapatite xylitol toothpaste that can help in those situations. So there's different strategies you can do for sure.
Okay. Let me see if Joe, if any other super chats came up, let me know. Let me get down to the bottom here. Oh, well, let's go over, actually, while we're here, Julian, let's go over let's go over your Love Your Liver experience. And then you had a couple of pictures to share that.
So I got into like the Weston Price style ancestral thing, right? My wife and I, we have a farm, we have our own chickens, we do the whole rotational grazing thing. And I was eating tons of eggs and bacon and avocado and everything. Like I thought I was eating super healthy, and I put on like so much weight. I was always an athletic, very like athletic kind of guy. And so I would get onto a workout program or a nutrition program, and I would lose 10 pounds, no problem, first couple of weeks. And then I would just get stuck, and I would be doing cardio and doing like everything. And the weight wouldn't want to come off. Didn't matter the macros I was doing. I was tracking macros, doing all that stuff. The vitamin A, I think, was like my biggest thing. And when I did the testing with you, my level was a 60. It was like 59.9. And so, and I was doing liver supplements and I'm eating liver, all this stuff, right?
So healthy.
So, yeah, so healthy. Yeah. So I started the low vitamin A in July, and then I went through like a significant detox. It really peaked in November. I was like sick all of November and just yellow mucus coming out of my nose for weeks. Pounds of yellow mucus. I probably could have filled a couple of mason jars. And the weight started, I finally got over the hump, and then I didn't have to try so hard to lose the body fat. It just started coming off like a pound a week or so, and so I think it was for sure for me, it was the vitamin A toxicity that, like, same thing. The body doesn't make mistakes. My body was holding on to fat to protect me and detoxify me from these toxins, and then once I figured that out, just started letting go of the weight. I still have to watch what I eat. I can't overeat. If I eat too much, the scale doesn't move, right? So it's not all vitamin A, but I think that was the missing link for me to be able to start to actually lose the body fat.
Have
So
you had
thank you.
any other health improvements? Sorry.
I have a lot more energy. I can wake up with not much sleep, feel fully refreshed, and start tackling the day. I used to be so lethargic. I'm kind of like a slow person. Like, I'm like an elephant type of person. My wife is she's like an Energizer bunny, and she's always 3 steps ahead of me and stuff. And I would just be like lethargic. We'd go for walks, and I'd be like, oh, I don't want to push. I don't want to walk fast. Like, and yeah, I have way more energy in the last few months. But like September, October, November, I was in a dark cloud. Like, I didn't realize it until I came out of it in December. And November was when I had the major detox. And looking back, I'm like, oh my God, like, I've been living in dark clouds for the last, I wanted to like quit my job, sell my practice, like move, I was like ready to like, I had dark times. Like, I had a lot of dark times the last few years. And finally, like, I really feel like I've turned the corner and I can like conquer now. So
amazing. Yes.
Yeah.
Awesome. Yeah. So that's really, you're another testimonial to what we're doing. And yeah, so awesome. That's
thank you for all of the wisdom. And like, I try everything. I'll try everything. Like, and so I have my own like regenerative pasture rotated eggs, and I don't eat them. We just like, yeah, like, so that's what I tell patients. I'm like, you got to be all in. Like, I'm sorry, if you want different results in your life, you got to change your life. That's it. Right.
Yeah. I remember Kelsey telling me about getting rid of her chickens too. After she got in, she just got rid. She was like, if I'm not going to eat the eggs, like, I'm not going to sell them.
Yeah.
So we'll just let go of the chickens. So yeah. So, okay. So, we will get, your show notes will be in the pinned comment after the show. We have one more super chat. This is from the lovely Beth Martins. She is asking, is the only way to know how deep a cavity goes is by x-ray?
Pretty much. You just can't see. You're trying to get a visual inside of the tooth, and you've no other way of seeing it. The thing is that dental x-rays have come a long way, and there's very low radiation. So, like, personally, even if it's my own mouth, I have no problem getting dental x-rays. I'm not worried about it. There's kind of, you can look at the amount of radiation. They measure it in, it's called microsieverts. And you can look at how much radiation you get from like a simple dental x-ray, or even the big ones we do, like the 3D ones that we do. And it's less than the amount of radiation you get flying in a plane. So most people are okay with accepting that level of risk by getting in planes, because we like doing that sort of stuff. And so the dental side is really, if you were doing it every day, then it's something to worry about. But yeah, it's very infrequent. I wouldn't be worried about getting a dental x-ray.
Okay. Let's see. Was there any, let me see if there's any other good questions. Beth asks, is there a reason silver isn't used in the mouth more?
Well, it is in the amalgams.
It is there in them, yes.
So no, it is like gold is considered gold has better properties for dental. So that's they used to be the gold standard. Like, dentists 30-40 years ago, they would say the best thing you can have as a dental restoration is gold. And I don't worry too much. Like, if all you have in your mouth is a gold crown, I don't think that's a big problem. The problem can be if you've got another metal, and then you can start having that battery effect that we talked about.
Mhm.
Then you can have more of that issue. Gold is pretty inert. You still would have I think you would still have the EMF concern maybe, but if you're not having symptoms and you're fine, then I would say you don't need to rush out and get like your gold crown removed.
Okay. Let's see. Here's a question. What does brushing your teeth actually do, and what's your opinion on that?
So, it's animals in nature. They don't need to brush their teeth, and they don't get tooth decay. So if as humans we were eating just a very like natural human sort of diet, you would not need to brush your teeth, and you would never get a cavity. You would never get anything like that. So toothbrushing is kind of a modern day answer to the modern diet. And so when you eat more processed foods and things like that, you can think of something like a cracker. Think about how much it gets stuck in your teeth, like those dried foods like that. They get powdery and they get caked on. And that's really what we're trying to do with toothbrushing, is remove that type of material off of the teeth. So does that answer the question? Yeah. Like I brush my teeth. I use this there's that company Bond Charge that makes these red light devices. They make an amazing red light electric toothbrush, and I just got it myself. It's like the best toothbrush I've ever used. So yeah, you got to be careful, because people tend to brush too hard and then they actually strip enamel away from their teeth. And so if you're somebody who your toothbrush gets like mangled and all the bristles get frayed and everything, that means you brush your teeth too hard and you're causing damage to your teeth and your gums.
You said Bond Charge, right?
Yes.
Okay, I was just looking that up. Okay, so yeah. Here, I'll type it in the chat. I'll look into one of those. That sounds
yeah, your teeth feel amazing with it. And then there's water flossers. Like the alternative to flossing is to use those water flossers, and they're a little more gentle, and there's less risk of cutting the gums and stuff. So I cover all that in that preventing cavities talk that I did.
Okay. Here's a quick question. I have 4 zirconia crowns over teeth where large mercury fillings were removed. They were not root canals. I hate the crowns. I have trouble chewing certain things, and sometimes it's painful. I had pain for years before removing the mercury, but I paid a lot of money for those zirconia crowns and don't have significant improvement in pain. What can be done?
Yeah, it's not necessary. Doesn't sound like a problem with the material. It goes back to the design of the teeth. It could be the bite that's off. It could be the shape of the crowns, like the other gentleman who was getting the food trapping, or there could be actually a problem with the nerve of the tooth, and it's damage that was done to the tooth from the filling and from removing the filling and then from doing the crown, and then the nerve of the tooth is not a healthy nerve anymore, and then that's why it's symptomatic. So it could be a number of things. And I would say, like, there's that biomimetic dentistry that I showed earlier. Like maybe if you could find someone or like a biological dentist or something nearby, and get some help like that.
Okay. So Baptized in Fire, he's a big fan here. He said he's a testimony to what you're saying. He said, I got a bunch of crap out from under a crown. I'm assuming a dentist did that. The next day I pooped emerald green and felt great for 3 days. Pooping emerald green. That's some stuff. Okay. So let me see. Okay. We got several thank yous for having you on. So thank you for coming.
My pleasure.
And let's see. Anything else?
Yeah, I figure like first time I figured let me put together a presentation, because visuals really can help with this stuff. And then I'm happy to it's a lot of work to put together these PowerPoints, as you know, but if you ever want to just chat or have more Q&A or that kind of thing, I'm happy to do it.
Do you have the slideshow on like Google Drive where we could share that itself?
I could do that. I'd be happy to do that. Yeah.
Okay. Just make sure to open it up to, the public. Yeah, just don't make them editors.
Yeah, right.
So
would I do it like I have it in Keynote? Would I export it to PDF maybe?
Yeah.
Okay.
I think it's exporting to PDF, saving it on. I mean, however you want to do it, but I just know I tend to do Google Drive.
Yeah,
and then you just go into the share and you make it so the link is open to the public.
Yeah.
And then you can send me or Joe the link in our chat and we'll put that on there.
Okay. Awesome.
So let's see. Oh, CEW with the submandibular bump. He said his bite. I guess I don't know what you've been doing, CEW, but he says bite has improved and lump is shrinking seemingly. Also, my musculoskeletal system is improving and self-correcting. I don't know if are you using the Revive mouth guard? CEW, just say it down in the bottom. And then here's an interesting question. Ray Love 33 says, my friend and I are both using the R1 mouth guard for a month. Do you know why mine now has a yellow tint? Hers is still clear. Is it because I have more bile in my saliva? I'm assuming you guys both had clear ones to start with because they make an R1 that's yellow. So if it started yellow, then it's going to be yellow. Like I'm using the yellow one now. I'll answer it for me. I remember, just like Julian was talking about, Dr. Camastra was talking about the saliva, well, the dark period of where he was dumping all this yellow stuff, yellow mucus. Okay. I had a period in my early Love Your Liver days where my teeth like yellowed significantly. What is that from? Like, what was Dr. Camastra dumping out of his mucus and his phlegm? I mean, it's probably vitamin A and other yellow toxins that were in the liver, and then the bile is also yellow. So if I was dumping it and it was coming, I mean, our saliva is made from the blood. So if you have more vitamin A, or you're dumping vitamin A, or you're leaking it into your blood, or your bile is getting into your blood, and those are both yellow. Bile that has not matured in the gallbladder is yellow. Green bile has matured, if you want to call it that, in the gallbladder. So you were probably just, if you're detoxing too hard or too fast, or it's just going to happen that way, and you have more vitamin A or more bile or more other yellow toxins in your blood, they can get into your saliva from the blood, or they could get there actually if you have any reflux issues, whether you know about them or not. That's the other thing about like sleep apnea people. If you have a chronic little cough that you can never figure out, you might have reflux triggering that cough. It's called silent reflux. People will say, well, I don't have heartburn. You have reflux. It doesn't matter if you have a heartburn or not. So a lot of these things, people will just say, I don't have it. And it's like, no, you can literally have it, but it's probably from the detox. I don't know if your friend is doing the Love Your Liver stuff, but if you were doing the Love Your Liver stuff and detoxing and then your friend is not, then I would say you're probably either pushing too hard or you're just going through a phase where you're dumping a lot of stuff. Do you have any other comments on that, Dr. Camastra?
I think your theory is as good as any. I don't have anything I could say. No, I don't have I think that's probably the best explanation. It's like the shirt. Like I've got a friend who his white shirts get stained yellow in the armpits and everything. And I think that's the same thing we're talking about, right?
Well, you sweat more. You sweat some more oily compounds. Your armpit sweat and your groin is actually it's a different composition of sweat than the other sweat because I believe it's the apocrine glands putting some extra stuff in there, some of which is fatty related. So that'd be my guess. And that, like I said, my teeth have whitened since that yellow thing. It will go away as you get less toxic. The yellow will. If that's what's causing your mouth guard to get yellow, that will go away. I can't say that the mouth guard is going to get less yellow.
Well, I'm glad to hear that that it went away because teeth can get stained and then they don't come back. So I'm glad that yours came back because like I personally would not want to have to go like shave away all of someone's tooth to put veneers or something. Like it's nice to hear that once it's cleaned out, the teeth respond.
Well, I would also say that most people, since they never detox, you would never expect it to go away, right? So the situation that caused it would have only worsened for most people. So that's the big difference that we're doing here. That's why we get to see these cool things that we don't usually see elsewhere. Okay, so let me see if we got anything else. Oh, okay. So Christina Sophia asks, hi, can severely receded gums be reversed? I've heard it's somewhat due to bone loss. I recently learned I have some osteopenia.
Yeah, it is due to bone loss because the bone is the structural foundation for the gums. So once the bone recedes, then there's nothing there to support the gums. So then the gums recede. And that's what I was explaining before in that section. It's super hard to come back from that. I mean, there's surgical procedures to, like, there's grafts and stuff like that can be done to, like, take tissue. You could take tissue from the roof of your mouth and then suture it in over top where the gums receded and try to get it to stay there. And so things can be done and it can help. But naturally, I've not really seen anyone successfully reverse that just on their own. You could arrest it. So you could stop the progression from getting worse. You can stop the progression, but to reverse the damage is I haven't seen it.
Okay, cool. Well, Christina, I would just say that you remember that 6+1 thing I went over earlier? There's that. And then whenever there's bone density stuff, you want to, in addition to making sure you're getting the right amount of calcium for you, you would want to generally load the bones. So if you got osteopenia in other bones, you want to somehow load the bones. That's what signals them to become stronger. And I don't know what Dr. Camastra would say about this, but also if you wanted to load the teeth, there might be some of those gums that are a bit harder, a bit stiffer to give.
Oh yeah, let me find that. I have it.
To give your gums and your teeth, so your jaw and your teeth some reason. You know, remember, bone has to have a reason to build itself. So if we're always doing soft foods, like, I mean, even on the Love Your Liver program, if you guys are making grains and beans and you're cooking the heck out of them because maybe you just like it that way, that's not going to be a lot of chewing. Or if you're doing always ground beef and you're not doing, whole pieces of meat, then that's not going to be as much chewing as if you had to chew like a piece of jerky or something like that. So that's where, like, when Dr. Camastra was talking about the chewing hard foods, like, I was the kind of guy when I would chew normal gum, I never cared. People would complain the flavor's gone in like 2 minutes. And I was like, why do you chew gum for flavor? Like, I just chew it to chew it. And I would chew it for hours. And when I got those hard gums, I think the last one I tried was Spartan, because it was before I knew about the really clean ones. It was the stevia one, but I would chew them for 3 hours. Like, I would go and go and go. And the flavor was never the thing. It was about the actual chewing. So I think that chewing thing is really helpful. I mean, you need exercise for the rest of your body. You also need exercise for your mouth. So
yeah.
Go ahead, Julian. What were you saying?
No, I found the gum that I was talking about.
Okay.
I'd be interested to see have a look at the ingredients to see if you think there's anything problematic in there. But I'll pull it up. Just give me a sec.
I know Rhonda, the airway champion, we had her on, and she has one that is just mastic gum. Now, I know just mastic gums sometimes you have to like chew them a certain way to get them started, or else they just fall apart. I don't know. So I'll try it. But I did like the Spartan gum, but it's not perfect. None of those gums are perfect.
Like I looked into mastic gum, and I guess my hesitation was that even though it's naturally occurring, there's like 70 different compounds in there. And I'm like, okay, I'm trying to do this whole detox thing myself. Am I going to be counteracting that by introducing something like this that I don't really need? So that was that's why I didn't jump into the mastic gum. So this other one is called Larine. So it would be, I think it's by Larine, LARINE.com. This one is a dental one. It's got like xylitol and hydroxyapatite. It's designed to help remineralize teeth. So yeah, I'd be interested to see what you think of the ingredients and see if that's something maybe we can.
Is it pretty strong for the chewing? Like, is it?
I think it is. I haven't tried it.
Okay. Cool. I will check it out. I need to order some, so I'll get on that right away. Probably order myself and Kelsey one of those toothbrushes too. Okay, so let's see what else we got. Do you need to go, or are you good to take a couple more questions?
We can do a couple more.
Okay. Let's see. Joe asked, is there any way to check the safety of the injections for pain for concerning ingredients? You're talking about like anesthetics, Joe, I'm assuming, and the lidocaine, and then people were talking about Do you have any comments on the nanoparticles in lidocaine dental anesthetic stuff that came out? Because I know Kelsey has lots of comments on that. So do you have?
It's such a mess. So that I don't.
If you don't want to go into it, it's okay.
Yeah, it's. I can go into it. I was wondering if it was going to come up because it always comes up. So people, you hear, oh, there's mRNA in the anesthetic. There's nanobots. There's all this stuff.
Well, literally, people will just make stuff up on the internet and imagine how easy it is to make AI videos. So how hard is it to make an AI picture of microscopy? I mean, we have to remember, folks, there is total like fear corn. There are the people out there who purposely make things just to scare people, and they will literally make up anything. And then it goes across the internet and everybody just believes it because it's something bad.
Yeah.
Like,
and it came from one of these alternative sources. So and so my colleague, so I'm connected with this group of dentists that I've done the training with and everything. We're all very like-minded with the health stuff, and we all want to help patients get better and heal. And so we, in our practices, we watch people get better once you take these things out, and you don't have to do anything special with the dental anesthetic. Even if there's some impurities or toxicities or whatever, that it is a pharmaceutical product. So there are going to be some things in there that probably are better not being in your body, but we're trying to achieve a certain goal. My view is that your body can detox from these kind of things. And that's what we watch happen with our patients, and they get better. So you kind of nailed it. My mentor in this, he said, this is a distraction. He's totally on board with us and all this stuff. He's like, this is a distraction for the patients, and it's just going to get in the way of them getting better. You see videos of people using magnets and all of that kind of stuff. I think it's kind of BS. The one thing that I've seen tests and stuff that were done, they found like graphene oxide in dental anesthetic. So that's the one thing that maybe there is some, from what I've gathered, that is everywhere. It's like in a lot of things. And so I feel like our bodies can detox it, you know? So I just think it's a distraction. I don't think, I watch people get better even if we just use the regular anesthetic. So that's my feeling on it.
Yeah.
It's impossible that it would be mRNA, because of all the sensitive handling things they needed to do with the mRNA, and it had to be stored at incredibly cold temperatures and all that. I don't see how they could, because our dental anesthetic is just sitting in a drawer for, like I don't see how that's possible. But
well, then there's the whole mRNA may just be a giant farce.
Right, I know.
So Joe, I'm going to share my screen, Joe, if you can. I wanted to go over. So the group that did a lot of I think the dental anesthetic is called La Quinta Columna, which means the term fifth column, as they say, La Quinta Columna, the fifth column, originated in Spain during the early phase of the Spanish Civil War. This is the important thing. This group literally named themselves after this. A fifth column or internal enemy is a group of people who undermine a larger group or nation from within, usually in favor of an enemy group or another nation. The activities of a fifth column can be overt or clandestine. Forces gathered in secret can mobilize openly to assist an external attack. Would you want to name your group after this? Are they not, they always tell us what they're doing. They always tell us what they're doing. And then when people are like, but this major university did it, I'm like, okay, if a major university did it, like I always say, once a Fed, always a Fed. Okay, the universities are still basically feds, and if they're sponsoring it, if they're letting their name be put on it, you're meant to see it. Like they know what they're doing. So they're going to scare you away. First, we have one side scared away from pharmaceuticals. Now the alternative side is going to scare you away from all supplements. And then they can scare you away from everything. So then you're stuck. What is their goal? Their goal is to confuse us. So we don't know what to do, because they sponsor both sides to get you confused. And that's exactly like, okay, the thing about, yeah, like you're saying there's graphene oxide all over the place. Is that good or bad? I can't say that it's good or bad, but is it all over the place? Yes. Do I believe that? I think a lot of the microscopy stuff where they're saying it's nanobots, as Kelsey says, having had microscopy experience, a lot of it, they're air bubbles. They're literally air bubbles. And they'll say, no, it's not air bubbles. And other people who have seen the microscopes are like, yeah, it's literally air bubbles. We see these all the time. And no, it's nanobots. And I'm like, okay. So anyway, folks, they're going to try to scare you to death into just basically not knowing what to do. You can't move. When they literally tell you if you get the flu, to just rest and drink spring water. Oh, a lot of people want to do more than that for their health. They don't want to just lay down and drink spring water. And then you go, well, why did they get sick in the first place? So anyway, that's a whole.
Oh, I know. I get people messaging me about GMO parasites and all, and I'm like, great. What are you gonna do? What can you do if there's nano? What the hell are you gonna do then? Like it's out of your control. So
yeah,
like
pray. That's what you can do. You can pray. That's about the only thing you can probably do if you believe it. You don't have to believe it. Folks, I was just talking to somebody this morning. If you're scrolling social media, they are going to find a way in to your brain through the things that you're watching. Like if you just pause on a reel, right, for too long, it will think you like it. It knows it got you. Whether you liked it or not, it knows it got you. And then they will start feeding you your fears. And they will play on it. They know their psychology. They are messing with you. It was a weird thing. Kelsey and I used to send each other reels on Instagram and whatever. And it was coming. I got to the point where I only checked it before bed. And then I would get into bed and I'd start scrolling and I'd be like 3 reels in and I'd be like, this is evil. There's something about this that is just really evil. And I watch a family member of mine just scroll all day. It's stop scrolling. Gee, just stop. Unless you're doing my shorts on like YouTube or something, but that's or maybe Dr. Camastra's. So anyway, but be very careful with what you are taking in, because they can get you. They know, they're reading your whole phone. We all know this. They're listening to your microphone. They're reading your phone. They know the way into you. So if you don't check social media, they have no way in. Okay. So anyway, that's my conspiracy theory stuff of the day. That's probably why my new viewers on this channel are going down, because they're like, oh no, he's exposing the secret.
Well, anyway. I like that La Quinta thing. That's a really good little insight there for sure.
Yeah, use that with people, because you're like, this is sketchy. Like the name is sketchy. It just tells you it's sketchy in the name. Oh, okay. Eliza says the Bigglesons have debunked the nanographene blood quinta columna for what it's worth, for the people in the chat who don't live online. Okay, cool. Okay, so let's see. Oh, this is just another thing. We'll just add this for all the MSG doubters. Phil Padzik says, I started MSG January 1st. My complete overall health went from 5 out of 10 to 9 out of 10. Best thing that ever happened to me. And they tell us MSG is bad, right? So, here in the West, we avoid it and pay the price. Okay, so let's just see. I think we're almost. Oh, okay. Christina Sophia asks, what do you think about the use of fluoride to strengthen exposed tooth roots? Is there a better way to do it?
Yeah, we generally recommend hydroxyapatite as the safer, healthier replacement for fluoride. So fluoride does help remineralize teeth, but it carries so much systemic toxicity to it that it's not worth doing. Hydroxyapatite seems to be a lot better and a lot less toxic, and it still has that remineralization function.
Okay, cool. Yeah, so I think that's all the questions. Beth Martins said congrats for hitting 13,000 subs. Yes, thank you, Beth. We did hit it in spite of the work that's going on against us. So is there anything do you want to give us? Well, why don't you give us your links, Dr. Camastra, again, just go so people can find you, your group and all that stuff.
Yeah, they'll be in the notes that I sent. So like I've got a Telegram group that people can join. My monthly calls and the one-on-one consults is talkin-teeth.com. So it's talkin without a G. So our dental office is terraindental.ca. My IV health lounge is canadabiohealth.com. I'm most active on Instagram. Yeah, that's about it. Instagram and Telegram.
Cool. Okay. Well, Joe, we're going to do a short link wrap up today because we've been here for a while. Let's just do the main website, Joe, for me. It'll just be nutritiondetective.com for us. We'll have, like I said, for all of Dr. J's links, we'll have them all in the info box, and I'll probably link them somewhere else, and then hopefully we'll get the presentation. For those of you who want to see this, as Eliza said, it was like instead of watching horror movies, you can just watch the surgery videos. Just see the goo come out. Anyway, yeah. We'll hopefully have that up so you can see it.
They can see it on the replay of because I don't know if I export maybe I'll export it in a few different formats, but yeah,
well, anyway, it's on this video.
Yeah, exactly.
People can just rewind and go watch it again. So,
Yeah.
So we'll wrap it up here. Thank you so much, Dr. Camastra, for coming in.
No, thank you. It's a pleasure. It's an honor. It's truly an honor. Thank you for everything you've been doing, and keep it up. And I'm happy to be an ally.
Where are you in Canada again?
Like just outside of Toronto.
Okay. Well, I may be having myself and someone I know and care about deeply. We may be visiting you up in Canada to go
anytime.
Get some stuff taken care of. So first we'll get the evaluation, and then we'll figure out what
I would love to help you guys.
Awesome. Okay, so yeah, Joe's posting some stuff in the chat, and we're gonna wrap it up here. So if you guys are interested in more from Dr. Camastra, you'll have the links down in the info box. I'm Dr. Garrett Smith, the Nutrition Detective, and nutritiondetective.com. And we're actually, maybe we should discuss the tooth powder that we're thinking of making. So that's very exciting. So maybe we'll have a chat offline about that.
Yeah, sure.
Otherwise, we'll wrap it up here. Again, thanks, Dr. Camastra, and we will see you all next time. Thanks for coming.
All right. Take care. Thank you so much.